Hello, everybody. Welcome to our virtual roadshow, our second of the series. We have a few people joining, giving it a minute or two for more to join us. But for those who are here, thank you very much for being with us or spending this afternoon with us. For those who are new to this program, we're excited to have you. Welcome to this community. For those returning from the launch event or the Tokyo Roadshow we had earlier in the year, welcome back. We have an exciting program for you. So I'll give it another minute or so. We have people joining as we speak, but thank you all for being here so on time. Welcome to everybody. And I see a lot of activity in the chat. Feel free to use it to communicate with one another. We will also have the ability to engage in the panel discussions where you will be able to post your questions in the chat. But in the meantime, feel free to introduce yourselves and one another through the chat and connect with the rest of the audience members. Where? All right. Here. All right. Well, I will get started as people continue to join us. So like I mentioned, my name is Cynthia Macias on behalf of the EPFL Innovation Park team. I'm delighted to welcome you here on our Zurich version of a roadshow. This is the second of our series for the Tech4Eva program accelerator. So after virtually visiting the Tokyo ecosystem, we're excited to continue the journey to learn about investment opportunities and emerging technologies around digital health and women's wellness here in Zurich, Switzerland. Today, we have gathered investors, health industry leaders, and experts to discuss key trends in digital health and the important role that women's health has in these growing trends. There are investment opportunities in the sector. More importantly, we're here to show you how you can be involved in supporting innovation in the sector. So we have a pretty packed agenda with a lot of thought leadership and discussion throughout the afternoon. And of course, the presentation pitches from our cohort growth stage startup companies. First, I want to really quickly thank our program support founders and the reason we wouldn't be able to be here today. For those of you who are new to the Tech4Eva Accelerator program, this is a joint initiative between EPFL Innovation Park and Groupe Mutuelle. And it's also supported by Ferring Pharmaceuticals, Fermata, Swiss Embassy of London, Joyance Partners, Swiss Next Boston, and Women in Wearables. And today's particular roadshow could not have been possible without the support of Business Angels Switzerland and the Swiss ICT Investor Club. So thank you all for being here and for supporting us. I'd like to introduce, as I mentioned, this program and this initiative is a co-initiative by EPFL Innovation Park and Groupe Mutuelle. Lanzo Guillet is Deputy Manager of EPFL Innovation Park, is co-director of this program, as well as Nicolas Leoyot, Chief Innovation Officer of Groupe Mutuelle, who is also co-director of this program, and we will hear from them in a minute. In the meantime, we want to introduce you, for those who knew, what the program is, what the program is about, and to learn more about the type of companies we're developing and the innovations and solutions that we're trying to push forward, as well as the community that we're building here, global community, not only in Switzerland, but around the world, and ways that you can participate. So I'd like to introduce Lanzo Guillet, Deputy Manager Director at EPFL Innovation Park, to give us a little bit more detail and overview on the acceleration program.
Thank you very much, Cynthia, and good afternoon, everyone. It is our pleasure to welcome you to the second Tech4Eva Roadshow in Switzerland. As Cynthia said, this is a joint program of Groupe Mutuelle and EPFL Park with ambition to create an innovation platform in Switzerland for high potential femtech entrepreneur and innovator around the globe to join forth together with forward-thinking cooperation to advance and to improve technology and solutions related to women's health. So for those of you who are not familiar with the term of femtech, it is used to describe technologies and solutions designed to enhance women's overall wellness, including period and pelvic health, fertility, quality of life during pregnancy or menopause. It could take the form of wearables, diagnostics, drugs, therapeutics, medical devices, mobile apps, etc. It is a fast-growing market that is expected to reach a 50 billion market size by 2050. So there are multiple factors that drive this market, such as raising awareness of the importance of women's health, the potential of positive impact on women's wellness, to the overall productivity and sustainability of the society. It is also a phenomenon generated by the increasing number of women in the technology community as they start to take care of themselves, start to take care of their awareness and health issues, which have been long-term taboo or neglected. So today we are here to discuss the question of why, what, and how to develop femtech. There are many challenges indeed, and very interesting topic. For instance, how to design personalized and female-oriented approach to general health disease management, and how to take into account women's biological changes along their life cycle, and to provide adequate support and ensure their awareness in family and at workplace, and how to draw attention of investor to this new and high potential asset class, as currently only 4% of technology investment in life science is aimed for women health solution only. So our mission, as indicated here for Tech4Eva initiative, is first of all to further raise the awareness that women's health deserve better attention, and also to identify, to promote, and co-create concrete femtech solutions to accelerate the growth of startups offering disruptive solutions. And by doing so, to foster an engaged community with not only women, but also men. We built the Tech4Eva initiatives with the philosophy that we offer equity-free, high-potential femtech startup companies. The initiative is currently supported by the combined financial resources and industrial insight of Group Visual with the network and track record of EPFA Innovation Park to bring tech startups to success. We operate with the model of corporate and startup partnership by involving senior corporate executive as well as successful femtech startup founders as mentor, so as to provide startup with access to potential customers and business partners. We also leverage our international network to make this initiative an international endeavor. So thanks to the support of our partners, we got 110 applications coming from around the globe and from different parts of the continents for this first edition, of which 33 are Swiss startups and 65% founders are women. And Tech4Eva is meant to be inclusive, while 15 growth startups and 15 early stage startups are selected into 2 different cohorts with distinguished and tailor-made programs. We invite all the applicants to stay within the community and participate in the networking and open innovation activities to address unmet needs. So here is the overview of the next slides. Here is the overview of the 3 distinguished activity streams in parallel that already started with respective objectives and participant group. Some of these activities are public and they are announced on our website, Tech4Eva. So I invite you to check it out regularly, and so you will be able to join. We warmly invite you, the audience, to participate in the following focus group as well as, next slide, as they are led by industrial experts and innovation catalysts from our network. The focus group has the mission to co-create new solutions to build a worldwide community of experts and enthusiasts to continually address unmet needs in these specific areas. For today's roadshow, we aim to further discuss why women health and femtech solutions are important with you and with a very interesting panel composed of senior women entrepreneur, a future women health professionals, and a woman top executive of Groupe Mutual. Our colleague of PwC will give you an overview of the digital health market as a large number of femtech solutions fall into this category. By showcasing disruptive femtech startups enrolled into our program, we like to set up the role models and illustrate what to be done. The presentation of the 4 focus group activities will give you a flavor about our approach and how this topic will be addressed and what are the problems that will still need to be addressed. And finally, we invite several investment professionals to discuss funding opportunities to support femtech initiative and to make this initiative sustainable. In short, today's roadshow is a warm invitation to you, men and women all together, to join Tech4Eva Open Innovation to co-create the future of women's health. Thank you. Back to you, Cynthia.
Thank you, Lan. I invite everybody to also follow on our social channels to keep up with the developments and updates from our companies, as well as other thought leadership pieces that we'll be pushing on the sector. Moving on to our first panel in the program, to learn more about the importance of women's health in femtech, I'd like to first introduce Tech4Eva's co-director and Groupe Mutual's Chief Innovation Officer, Nicolas Loleil.
Hello, thank you, Cynthia. Thank you, Lance. I'm very pleased to open the second Tech4Eva Roadshow that we call the Zurich Roadshow, despite it's still virtual on this one. And we will start with a discussion panel. On May the 20th, we started to investigate the global dynamics of femtech, the femtech industry with the situation in Japan. And today we want to go deeper on this topic by identifying the pain points and the opportunities behind the femtech and how we can help grow the femtech segment and even help the cause for those who consider it as a cause like myself. To set the scene, we invited 3 important ladies to share their experience and their views with you. There are 3 ladies with 3 different profiles and backgrounds, which are making this panel quite interesting. So for 30 minutes, I will be pleased to investigate their points of view. For you, with an idea in mind, is why do we have to talk about the femtech segment in 2021? So that's the rationale behind the conversation that we will have in the next minutes. But let me introduce you the 3 guests, and I will start with the youngest of them, the youngest of the panelists, and she's Oriana Kraft. Oriana is a 22-year-old medical student at ETH-Dev. So it's very young, and she's an amazing person. Has founded the Femtech Summit that you hopefully have heard of in the spring. I think it was in May 26th and 27th, if I remember well, and it gathered something like 600 viewers for the 2 days. And you can find this initiative on the URL, which is femtechnology in one word .org. So after the Tech4Eva roadshow today, you can visit. Interesting one. Then we will have Trudy Emily. She's a partner as SNGLR Group, an investment and consulting company. Trudy is also the president of the Swiss Health Angels, a business angel club. We invest in health tech startups and in femtech, namely. Trudy is also the member of the board of InnoSwiss, the Swiss Federal Agency for Innovation. And we will have Sophie Ravin. Sophie is from Groupe Mutual. She's director and chief operation officer at Groupe Mutual. And but I will let her introduce herself directly, because before starting the conversation and the questions and firing the questions to you ladies, I would like to hear each of you about a quick. I will have a quick question to each of you: is why joining this panel? What are your drivers? Why do you want to? Why did you want to talk today with me? And I will start with Sophie first.
Hi, Nicola, and good afternoon, everyone. I hope you can hear me well, and I'm very happy to be here today with all of you. As you said, Nicola, I'm a member of the executive committee of Groupe Mutuel. It is a health and life insurer in Switzerland. We are number 3 in health insurance in Switzerland. It is a market in which health expenses reach 80 billions per year. So it's really a huge market. And we decided to co-found Tech4Eva, I think for mainly 3 reasons. First, we saw that only 4% of health investments are specifically dedicated to women. But we all know that more than 50% of the population are women. So there is a huge gap. And we need to change this. And we really want at Groupe Mutuel to change this. The second reason is we insure people. It is really a great responsibility. We have 1.3 million individual customers, and we also have close to 26,000 corporate clients. And 50% of our customers are women. And nearly 63% of our employees are also women. So we really think that technology, innovation, and innovative solution should also be at the service of all these women. And the third reason is we are not an illness insurer. We are a health and life insurer. This means we are not only there to pay bills when something went wrong. We do pay bills, but our role is really to support people, to offer innovative solutions for better treatment, for better prevention, for better services. And this is why we decided to co-found Tech4Eva. And I'm really proud that we did that.
Thank you, Sophie. Trudy, what is your drivers? Why did you say yes when I reached out to you?
Yeah, hi everyone. It's great to be here. Why join this? I think first and foremost a lifetime of frustration at not having. I mean, I think the oldest on the panel, that not having my needs met over most of my lifetime. That's a starter. And every time, I mean, I've worked all my life in the pharmaceutical industry. Not having our needs properly represented, not our, for whether it's treatments or whether it's how clinical trials are run, and the exclusion of women, all sorts of reasons like that. I just, on top of that, having left the pharma industry and gone into startup world, to have seen so few women in entrepreneurship, in the Inner Swiss trainings. Now there are a lot more, but we were losing a lot between the training and actually founding startups. We tried to sort of figure that out and work on solutions to help women stay in entrepreneurship, to take the risk, to have a go, and to bring their ideas to market. So anything that I can do to help support that effort, to bring more women in on all sides, also from an investor perspective. We in our group of investors at Swiss Health Angels, we have over a third of the investors in the group are women. More women investing in health means also more women receiving investment from investors. More women in the room of investors also mean better understanding of the technology that's being presented. So I think anything I can do to kind of help forward that, help bring that forward, help to move people into this environment, especially women and particularly young girls, to have role models of many of the founders that will be presenting today, I think is a fantastic opportunity. So anything that we can do to change the paradigm and give the next generations a better life than I personally can say I've had over the past 30 years or so in work.
Great, and it starts today. So as you talk to about young women, I'm just asking the same question to Oriana. So Oriana, we talked together since the Femtech Summit in May, And but you said yes, of course, for this roadshow. What is your cause?
Well, yeah, first of all, thanks so much for inviting me. But for me, I think it's not only the fact that there's a lack of solutions, which there's a lack of diagnostic means and a lack of therapeutic means, but that there's like a lack of awareness around the issues. It took 3 years of my being in medical school to hear about a lot of these diseases for the first time, even though things like endometriosis or polycystic ovarian syndrome impact 1 in 10 women, but I had never heard of them. And then when we were finding out about these diseases for the first time, they were telling us, oh, but we still don't have an established diagnostic procedure, or we still don't have an established therapeutic procedure. So these diseases that impact huge portions of the population still don't have solutions. And that's obviously a huge issue, but in order to come up with the solutions, people need to know about it. And Femtech, I hadn't heard about it until, a couple of months before I started organizing the summit. So I think the first step is really getting people to know about these problems, and then they can start coming up with the solutions.
Okay, so it's mostly awareness. Sophie, you represent, and back to you, you represent one of the largest health insurance in Switzerland, and you explained why the drivers of creating or being involved in Tech4Eva. You said that you mentioned 26 corporate clients, and you have 2,500 collaborators, and 65% of these collaborators are women. Why did you perceive as trends in the past years, and especially maybe in the corporate environment? I think it's a topic quite interesting for the startups which are attending today, because most of them are targeting this type of clients. Did you identify some specific trends?
So yes, as you said, we have 26,000 corporate clients, and we clearly see that their needs are evolving. Our corporate clients, they clearly have understood that prevention and health management, especially women's health, is a key success factor. And this leads to the fact that these corporate clients are looking for more support. And we see that, for example, with pregnancy. And this is the reason why, for example, we have experienced midwife who can help these corporate clients in dealing with the topic of pregnancy. But this is also the case for other topics that are less and less taboo in companies. For example, this is the case for mental health. It is the case for contraception, for fertility, or for menopause. And I think that for the moment, we don't have enough adapted solution to address these new topics. So Tech4Eva will really help us to develop new solutions so that we can address these unmet needs. And for example, this Tech4Eva focus group, this will help us to better understand the real pain points and also the potential solution. So we really see that there are new needs from corporate clients, and we really need to work on finding solutions to address these needs.
Okay. So Trudy, you're on the other side of the gate, if I understand well. I mean, you are an investor in health tech, and you have a rich career at Novartis, so which is what I call the other side of the gate, the vendor side of this industry. Do you perceive the same trends on the other side of the gate as a solution? I mean, you are in touch with solution providers. What are the most visible trends in the femtech innovation world today?
I think, well, first I'll just make a bold statement here that I don't think many of the big pharma companies are doing anywhere near enough to tackle female health. I know Ferring is listed here as one of the sponsors, and I think they're one of the few that are making significant efforts in the area of women's health. So I find that personally quite disappointing. most visible from an investment perspective now, as we look to see what's being developed, for me, are more sort of, there's a lot more active and visibility in the digital health related products that kind of use big data to analyze our physiology or mental health, as Sophie mentioned, and provide feedback to us and health reports, whether it's for a better understanding and management of our menstrual cycles, or seeking to get pregnant, or monitoring pregnancies as they're going on. There's also some developments in the gynecological equipment area. So, every woman knows how intrusive and sometimes painful our visits can be, whether it's placing an IUD or in squeezing your breasts really flat to do a mammogram, which at least in Basel-Stadt is now free of charge every 2 years. Whoopee, that was a great 50th birthday present I received a few years back. So exciting. But improvements here are also really welcome. I think there are some improvements in diagnostic tools, but I have to be honest. I find it unfortunate that there's a particular focus on breast cancer. I don't mean that in a negative way. So, it's good that there's improving diagnostics in the breast cancer field, but it's unfortunate because breast cancer has great PR management and has had for several decades now. Everybody knows about breast cancer. It's a very important part of the body also, from a male gaze perspective. But there are so many other fields of women's health, for example, heart disease that kills more women now than men, because women's heart disease presents itself very differently to male heart disease. We don't grasp our chest in pain and that's it. It's felt very differently. It gets undiagnosed or diagnosed extremely late. That's why so many more women are dying of heart disease today. And endometriosis that Oriana already mentioned is just either underdiagnosed or diagnosed extremely late. It's a very painful disease, and uterine cells that are in other parts of the body that cause then pain during the menstrual cycles. It's very debilitating, and it's just not talked about. And another one that's not been mentioned, where we're beginning to see some companies come in, and one of them will even present today, which is MoveOn, is in the area of urinary incontinence that affects over 40% of women at some point in their lifetime. 40% of women. So let's say almost a quarter of the world's population at some point in their life will be affected by urinary incontinence, either post-pregnancy or post-menopause, or very late in life. And men too, later on in life, I should say, as well. But it's a taboo topic. It remains still largely untouched by research. And as I said, that is beginning to change. And I'm happy to see MoveOn presenting later today. So I think there's increasing visibility, but it's still a very, very early days.
Yeah, talking about urinary incontinence, we have a dedicated focus group for addressing this topic. It's led by Marta Giring, who is attending today. Say hello, Marta.
Hi.
So yeah, that's something that we address definitely. Oriana, you said that you didn't know much about Femtech 4 months before your summit, so it's great to have set up a summit in 4 months. It's amazing. But what were your drivers? I mean, as a young woman, you're not really involved in pregnancy yet, not in menopause, not in. Is there something specific to young women in the Femtech?
I mean, for sure, contraception, understanding your cycle. I think when you enter university or high school already, you get confronted with those issues for the first time. And I think for a lot of people, at least all my friends that I've talked to and all my fellow medical students, they find it really frustrating and dissatisfying. The solutions and the options, as we all know, a lot of the birth control solutions come with a ton of side effects.
You answered 11 out of 15 questions.
Yeah. Well.
Yeah.
I think, yeah, exactly. It's not very satisfying, the solutions that are on the market for the moment. And the solutions, not just in terms of contraception, but in terms of diseases. I think it's particularly frustrating when you look at the history that it's not like we're just finding out about these problems. We've known about these problems for a very long time, but it's been relegated. Like endometriosis used to be just branded hysteria, that women were crazy, that they were in so much pain. And that's why there wasn't a lot that was done in it. Or the fact that women were excluded from clinical trials because fluctuations in hormones were seen as too complicated, even though it's a reality, right? You need to take the fluctuations in hormones into account when you're doing those clinical trials, but the research wasn't done, and so now we don't have the solutions. I think, yeah, just being frustrated in general that even though this is stuff that we've known about for a very long time, progress hasn't been made and still isn't being made, because it shouldn't take 3 years of medical school to find out about these diseases and about these issues, I think.
Yeah. Okay. And maybe this hormone fluctuation is also impacting women's career somehow. I mean, this is some kind of information that we got as well from the beginning of this Tech4Eva program, and so this is something that you consider. I mean, as I think you're quite involved in the women's career cause. That's what I understood from you.
Yes, yeah, that's true. I've had a long and very, very good career. I was promoted during both of my pregnancies. I've spent most of my career in very male environments, in sort of technical development and production. I'm kind of used to that. It takes a lot of courage, however, let's be honest, in those kinds of environments, to sort of like ask for a chair if you can put your feet up during a meeting because you're heavily pregnant, without that negatively impacting you, or as I did, having meetings while lying on a mattress in my office, because the gynecologist wanted to send me home half a day, every day, so 50%, and I refused. So I put a mattress in my office, and I had meetings lying on the mattress while talking to staff at the desk. I mean, I think the key issue is I've done that, and it's important that we do that, but it's very difficult. I mean, how often do you hear women asking to step out, because they have a hot flash right now and they're dripping wet and they just need to dry off before they get back to, hold that thought, I'll get back to you in a minute with my answer. I need a couple of minutes in the bathroom. It's very rare, but at the same time, what I noticed is that the more I talked about that kind of stuff and integrated it into sort of daily life, and lay there on the mattress having conversations, looking up at my staff, that kind of thing, I think it becomes normalized. People joke about it, but it's just, I get the job done, so what does it matter? And I think kind of including those points in the conversation makes a big difference, whether it's issues with menopause or painful menstrual cycles and so on. But if you don't talk about it, if we don't sort of demystify it, if we try and pretend that it's not happening, no one's going to take any, no one's going to support you or find it acceptable, or so you just suffer in silence, and that's not getting the job done well. So I think the more we demystify the whole thing, the more we talk about these, and it becomes part and parcel of normal everyday work, the less of a bother, the less of a problem it would be, because you're still getting your job done. It's just that, you have to occasionally step out or what have you, or you work from home because you're in pain, or, these kinds of things can make a difference. So I don't think, in all honesty, that it helps to kind of hide this kind of these kinds of issues. I think the more we talk about it and make it normally part of the normal day, will make a big difference. That's just my thinking. Okay.
Yeah. Oriana, you are the most medical of the from the four of us. you are doctor students today, and what I'm just asking you the question: why is there some inequality in medicine today between men and women? What is your perception? Or is it real first, and why?
I think it's definitely real. I think there's a lot of factors, though. It's not just one answer. I mean, I think the education starts with the education of doctors. That it's not probably as well known as it should be that there are sex differences in every single cell of the human body. I think we have a tendency to think that the only differences between men and women are reproductive organs, which are very different and have a huge impact. But if there are sex differences in every single cell of the human body, then it impacts the way heart attacks manifest. It impacts your propensity to get lung cancer or not. It impacts the way all diseases manifest, the way you metabolize things. And because that's not as well known, we tend to have a one-size-fits-all approach that a lot of, for example, drug dosages are made for 70-kilogram males, which is obviously not the right dosage for women. It's gonna have all sorts of extra side effects that men wouldn't have to suffer from. I think the other fact that women were excluded historically from clinical trials means that we don't have a lot of the drugs that we have nowadays were optimized for men. So therefore they have extra side effects on women or don't solve the problem as well for women. And also diseases that maybe only impacted women weren't as well researched because men maybe didn't see the need to investigate endometriosis because they didn't have that disease. I mean, I think there's a great story which talks about the compound that's used in Viagra, that they did trials on it and they saw that it could ease menstrual cramps or it could be used to treat erectile dysfunction. And erectile dysfunction impacts something like 20% of men, whereas cramps, I think there's something that shows that it impacts around 90% of women at some point in their lifetime, right? So it's not only that it's the right thing to do to have equity between men and women in medicine, it's also that there's a huge market opportunity. If you have something that you could sell to 90% of 50% of the population, it's a lot more valuable than something that you can only sell to 20% of 50% of the population. But because those researchers themselves maybe never experienced cramps, they didn't see that there was a need for that, whereas they could very much see the need for coming up with a drug for erectile dysfunction. So I think there's a lot of factors.
Yeah, it seems the awareness is as you mentioned before is the key drivers of this problem, which is quite something that we can relate to the corporate environment. I think I don't know what you think, Sophie, but do you perceive the same thing, the same trends internally at Groupe Mutuel, or just more generally? Talking as a large employer in Switzerland, do you feel that the corporate world is aware of all the difference that can happen between men and women and the impact on their career and everything?
I think we see that the trends internally are quite the same as in other companies, so the same as our corporate clients. I think the awareness is not yet enough high, it's clear, and that's why we really need to work on this. But I think what is more clear today is that there is a better understanding of the link between health and career. So there is a better understanding of the fact that a better health will help to have a better personal development, to have a better work-life balance. And it's a fact, actually, better health is a better foundation for a successful career. And I think developing women health will also help women to have a more successful career. And not only women will benefit from this, but the whole society and the whole economy will benefit from this great added value. And our role as responsible company is really to put all conditions in place to see more and more successful women. And one of these conditions is health. And this is why we put a lot of initiatives in place for employees' health. And actually, one of these measures is Tech4Eva. One of these answers is Tech4Eva, because participating in Tech4Eva will also help us to address the new needs, the new expectation of our employees. It will help us to be employeur de choix. And last but not least, it perfectly fits with our values that are to be caring, to be proactive, and to be responsible.
Yeah, that's true. Oriana, back to you. You're the youngest, and your career is in front of you. What is your hope and your dreams for the FemTech How do you see the evolutions in a longer time scale, maybe 10 to 20 years from now in this domain? What do you?
Wow, that's a lot of pressure. I think the first part is maybe, I don't know why it has this reputation of being a niche thing, femtech, right? It impacts 50% of the population. It shouldn't be niche. It should be mainstream. It should be an accepted part of the healthcare ecosystem. And in that vein, expanding the territories that femtech deals with. If you know that sex differences impact every single cell in the human body, it's great, and it's completely necessary that we have a lot of femtech startups that are targeting fertility and contraception, because those are hugely important topics. But it should also be going towards mental health. Or I think you mentioned there's a startup that's doing stuff for hearts and for cardiovascular disease. It should be dealing with every aspect of the human body, since there are differences in every aspect of the human body. And I think also maybe having more of a through line. I think right now, because femtech hasn't been around for such a long time, there are a lot of startups that target the diagnostic area or the therapeutic area. And so it's very fragmented. So if once women are diagnosed, maybe they're not connected to the solutions they need, or there's just the solutions, but they can't get to the diagnosis. So making a through line, you help them get the diagnosis, you help connect them to care, you help them connect to the community, and then you connect them to the therapy that they require. And yeah, hopefully there won't need to be as many panels like this raising awareness about femtech in 10 to 20 years. It will just be accepted. People will know about it because, you know, it's a necessity, I think.
Yeah. So that's on the long term. On the shorter term, what can we do, Sophie, for instance? As I ask you the question of your two sides, as a corporate leader and as a health insurance company. What can we start if we want to start next Monday? What do you have things in mind, or?
So first of all, I really share the opinion of Oriana that said it will become mainstream. I really think that Tech4Eva in the coming year will become mainstream. And I see there really a great market potential. And at Group Mutual, we really don't want to miss this opportunity. And I think one thing that is really important is we are talking about improving women's health through better prevention, through better treatment, through better services. So we at Group Mutual, we can provide the access to the Swiss insurance market, but we cannot solve the problem alone. No one can solve the problem alone. And I think we really need to work all together if we want innovative solution to emerge. We have to have all players around the table. And that's exactly why we co-founded Tech4Eva with the EPFL Innovation Park, to have the best innovators in the femtech fields, and also to have the best investors. So it is not a job for only one actor in the system. Every player has to play this game if we want femtech to go further.
Yeah, and we need to support these players, these actors, maybe with money. That's the essence of the growth of innovation. Today, you have a strong foot in the funding sector, and you also at the board of InnoSwiss, the InnoSwiss Council. Do you think the femtech segment has received enough visibility among the investors to sustain this vision that we received from Oriana and Sophie? And what could we do to improve the situation? What could you do as an investor or as an InnoSwiss leader?
So I think I'd like to kind of go back to something Oriana said right at the beginning, because that's a key driver for this is the distinct lack of data that's available in understanding women's needs and the diseases and the impacts. Just not enough information out there. And because of that lack of information, it's very difficult to create visibility or sufficient visibility for the issues. So the more we do, like with Tech4Eva, in supporting startups, in finding solutions, in gathering data, more effort needs to be done to gather data. And the more we can do under the same roof for better visibility, that will certainly help. My concern is also, though, that that was mentioned earlier is the danger that as labeled femtech alone, that it may be a little bit excluded from the sort of the innovative tech development in general, because it could be perceived as separate and therefore maybe a lesser field, which obviously it isn't. It's a significant gap that needs to be filled. But as more data is being gathered on women's needs, and as more of that data is being published, I think it's generating a genuine interest, especially among women, but not exclusively, that will allow for real innovations to be developed in order to address those issues. But I think there's a long way to go and a lot of work to be done. From an investor perspective, especially business angels, business angels, it's their own personal money that they're investing here, and business angels like to therefore minimize the risk by investing in fields that they're familiar with. So, even though we have over a third women in our business angel club, that if you're not familiar with it, you're still going to be uncomfortable at investing in it. So the more data we can gather and the more familiarity with the field that we can have, I think the better. I know that I still struggle, to be honest with you, and maybe the panel later today will answer this question. Why is it that so many investors think it's okay to ignore the business potential of half the global market? I mean, the market of women is 50% of the world. So why are not more investors, knowing that 93% of investors in the VCs, etc., are men, why are they not investing in a huge business potential here with untapped markets, so that they can get into the game and make good money? And I'm sure it's because of lack of visibility and lack of data. And so it's not just a case of getting the data to them, it's also a case of them please picking up the phone or doing internet research, is talking to people who can get hold of data and find out more about these diseases, find out more about these gaps that are not being addressed. And then you mentioned InnoSwiss. So just from an InnoSwiss perspective, and you may or may not have noticed, and I hope you have noticed, that over the last few years, we've been working quite hard on increasing visibility of women entrepreneurs in particular. And also in these conferences that we sponsor, we've specific gender criteria to ensure that we have more women on stage presenting or pitching. And that's important for us. Also from our entrepreneurship trainings, we have gender requirements for people in the audience, but also the trainers on the stage presenting and training people in entrepreneurship. And we've also increased significantly. There was an announcement only a few days ago about the increase in women coaches in the startup coaching area for InnoSwiss. So, and looking at even the Swiss Startup Days that was on recently, you see a significant increase in the women involved in that day versus a few years ago. So it's all an effort to sort of, or a good example to show how we can generate real change and increase the awareness. But if you want to know, really what else can be done, I'd say to investors, specifically review your screening process. Try to make it more objective and less prone to bias. We're all unconsciously, we women too, by the way, unconsciously biased towards a certain kind of message. Really try and get a diversity of pitches in. Look for fields based on opportunity, not just on what you know and you're familiar with, but look for opportunities. And then these markets that address women's needs are, of course, unmet opportunities that have the greatest possibility for success. So I'd just say educate yourself and don't miss out on some incredible technical developments, and some of which they're being presented today.
Thank you. Interjecting, sorry, we need to move more time. So just wanted to circle back.
Yeah, thank you, Trudy. I just wanted to wrap up on this. I couldn't look at the questions in the chat, but Cynthia, do you have a few questions, or do we have time for a question?
No, we don't have time. I'm sorry, we're over. We gotta run.
Okay.
But please keep posting them in the chat, and we'll get to them at some point later in the program.
And we will keep the questions for the investors in the second
Yes.
panel, and then leave you the floor, Cynthia. Thank you.
Yes. Great. Thank you. Thank you all. Thank you,
Thank you,
Nicola, and the
Sophie. Thank
panelists.
you, Ayana. Thank you, Trudy.
Thank you all. Bye.
Thank you. So moving on to the next panel, as we've seen a trend growing in the digitization of healthcare, and we know from the pandemic this is here to stay. So to learn more about insights on key trends, on healthcare in general, I'd like to introduce Isma Hachi, Senior Manager of Life Sciences at PwC Switzerland, who has spent the last 13 years actually in life sciences, medtech, and biotech, consumer and healthcare clients all over both Europe and the US, expanding and developing business strategies. So Isma, thank you for being here, and thank you for providing trends to learn for us what trends are happening.
Thank you, Cynthia, and thank you for everyone. Hopefully you will see the slide coming from Sylvan. So really fascinating discussion, and I'm really delighted to be part of this Tech4Eva event with you all. So as mentioned by Cynthia, I'm a senior manager at PwC, and I have two PwC colleagues are joining me today, Chris Essler and Sylvan Wetwer. So it's not going to be completely tech for femtech, this report, of course, but we have to look at the biggest picture, right? Because like mentioned, femtech is not only talking about fertility and other women-specific issues. Women are everywhere. We are sick for any diseases, and which means that we can see the biggest picture here and see what's the opportunity for femtech. And this is really the purpose of presenting to this report, to really question ourselves, where is the opportunity for femtech? And mostly with the COVID situation, we have challenges that generated opportunity. And that's really the purpose of this presentation, to kind of give you some key trends there. So going to the next slide. This report, the key findings that I'm going to present are from interviews with health industry executives, but also survey that was with 10,000 consumers in 10 countries. Going to the next slide, before we go directly to the issues that have been raised during those interviews, we would like to focus a bit on the biggest picture. And before the pandemic, the COVID pandemic, we had some healthcare transformation happening, of course. And some of them are really related to having this bigger picture, focusing on well-being and prevention, being better patient and physician experience, and also greater take up of digital, which is an important topic in femtech, complemented by a new word, new skill workforce of the future. And also the push to develop cures and ecosystem solution beyond the pill in addition to the treatment, and also paying based on outcomes and rather than fees for service. And those changes that are happening in healthcare industry will hopefully address major issues that we are having across all sectors. And this is excessive cost, for example, interoperability, which is related to the health record data, and collaboration in building trust. So before we present the report, we would like first to get your answer and feedback from your perspective. What will be the main issue that will shape healthcare across the world in the years to come? So I will hand it over to Sylvan.
Hello, everybody. My name is Sylvan, and I'm also a member of the PwC delegation. And my role today is just to lead you through the Mentimeter. We'll use the Mentimeter to sort of do a pulse check and see what you all think about these issues. Most of you have probably used Mentimeter before, so you know how to access it. But for those of you who haven't, or those of you that need a refresher, there are two ways to do so. You can either just scan the QR code on the screen. If you have an iPhone, just point your camera at it. If you have an Android phone, you might need a dedicated app. Or the other option is to go to menti.com and enter this 8-digit code that you can see here. Good. I'll give you just a minute to kind of make your way over. And if you have any questions, any technical questions in the meantime, just let me know.
And you can use the chat if you have technical issues. The goal is really to get a bit of your feedback on what you believe are the main issues.
All right, I hope most of you made your way over. If you're a bit late, that's no problem at all. You can still access the slide. So there we go. Just to wit, the question we would like you to answer or give us a response to is, from your perspective, what would be the main issue that will shape healthcare across the world in years to come? So again, I'll give you a minute just to make up your mind. All right, we already have some early contributions. Good, equality seems to be something.
Mute the event only. You see, I have the Zoom screen open. Okay, it doesn't matter.
So digital access, privacy, aging. This is good. Personalization.
Mm-hmm.
Okay, excellent.
Good. All right.
So going back to the presentation, and that's really nice to continue to add words. This is really fantastic. The 4 issues that we got from the Pharma Life Sciences Executive as well as 10,000 consumers are the first issue is related to a future hybrid care model and the right balance between virtual and in-person care. The second one is related to data, and we saw that on your response, and it has been raised by the panelists. Data, lack of data is important, and this is an issue across the whole industry, and understand how we can really handle this analytics capability and make it driven by an ecosystem approach. The third one is highlighting the challenges, but also the opportunity related to virtual trials. And we were able to see that with the COVID. And finally, the last one is related to supply chain resilience. And this one we are not going to cover today, but I invite you to look at the report if you are interested in these last issues. So going to the next slide, we all know that this pandemic has brought major challenges and has impacted all aspects of our life, of course, but we have to take a look at those as healthcare players. We have to look at those challenges as opportunities for us to improve the healthcare ecosystem and focus on better outcomes for patients. And those opportunities really are COVID has been playing a role of digital enabler, of ecosystem facilitator. And we heard a lot about taboo and things like that during the panelist discussion. Actually, there is a big problem around behavioral changes, how we can accelerate those behavioral changes in femtech. And we were able to see that COVID was able to accelerate those behavioral changes. And we heard also a big issue with mental health, and something that probably we want to consider. And there is an opportunity actually with the COVID. We have a significant comorbidities related to COVID, and this really required an additional attention, because right now we are just focusing on the COVID, but there is on the background so many comorbidities issues. And actually I have been interacting with some key opinion leaders in mental health, and they mentioned that some evidence data shows that women are more vulnerable to mental health issues related to COVID, and mostly women who are pregnant, postpartum, miscarrying, or even women experiencing intimate partner violence. And we saw that actually the lockdown has increased that, and that's really something we should consider as an opportunity for the femtech industry. So going to the next slide, let's start with the first challenge related to virtual care. Before I go to the 3 key findings you have here on the slide, I would like to highlight just the consumer have an extremely high interest in remote care, even if they are able to return to in-person care. And that has been a huge change related to COVID, and really a positive impact. And also, one example very quickly, this has been driving a lot of investment in digital solution and what we call holistic virtual care services. And we know that some of them are in the consumer space, other in healthcare. I like to give this example because I feel it's very relevant for femtech. In January 2021, a consumer-facing digital health startup, Hims and Her, completed its merger in a deal valuing the company at 1.6 billion. It's a cloud-based solution, just having a holistic virtual care services, but Him and Hers have been clearly taking advantage of this COVID situation and are currently partnering with health provider payers to build a hybrid model. And the hybrid models means that we are not going only to focus on a virtual care model, but actually we want to have the right mix between virtual and in-person care model and be able really to take advantage of this virtual trend. So of course, there are significant challenges to determine the right balance between virtual and in-person care. And this challenge is also actually related to a second finding you have on this slide, which is the right experience. We want to offer the right experience for the main stakeholders who are the patients and the physician. And they need to see an advantage of this hybrid model, including virtual care. And finally, this will not happen without really a well-established reimbursement strategy. And this is really a key driver to allow these hybrid models. So going to the next slide, if we focus on what are really the implications of this shift to a hybrid care model, we have identified three. Inequity, and we heard about that, but in a different way. Here we talk about inequity for people who are not having access to mobile devices, connectivity, and actually there are over 3 billion people, and we have really to consider that. There is another implication is health data privacy and security, and cybersecurity effort must be boosted to provide a safe and secure experience. And finally, organizations need to manage for change by upscaling their workforces, building digital fitness, and helping employees adjust to changing work practices. And this is what we call new work, new skills. It's really about that. And it's really, this is a change that is happening. And this is because of the COVID that accelerated those changes that were happening before the pandemic. So let's continue with the next slide, which is the second issue related to data analytics. We heard from the panelists, data is important. Data is important not only for femtech. Actually, we are in the era of data. We love data, but we have so many data that actually we have to take actually not a data-driven approach to make it happening, but an ecosystem-driven approach. And while we are talking about the ecosystem, let's start with the first one, build data analytics capability. That's the foundation, of course. We need these capability in order to have a data-driven approach. And actually, I like to give this example as a femtech example. You don't need to be very technical focus to have this capability. It can happen very easily with the current advancement we have in artificial intelligence. And there is one femtech company called LactApp focusing on health outcomes with a data-driven approach at an affordable cost. And LactApp is a Spanish startup focusing on improving outcomes and care for breastfeeding mothers. And those mothers are asking questions for breastfeeding related question. And I'm sure a woman will understand how it's hard and not intuitive to breastfeed. This is something complicated and there is no support. And they are providing a very simple AI machine learning based solution to answer immediately to this question in real time. And this is just an example of a capability that could be implemented and deployed. But in order to take a full advantage of this capability, of this data analytics capability, taking an ecosystem view is really a must-have because no one organization holds really the keys for all type of data, accurate data, the right set of data. So there is a need really to build this ecosystem, to gather the right set of data and make sure that we are not only focusing on healthcare data, and mostly for femtech, there is a consumer piece here. And we want to think outside healthcare and gather non-traditional sources of data, maybe consumer or other source of data. That's really important to be cross sectors, and that's even true for femtech. And finally, because these stakeholders within an ecosystem have different goals that need to be aligned with on the right value proposition that is clear for each stakeholders. So in terms of implication, what it means for harnessing data analytics, We need to use data, of course, and we need to use them wisely. By leveraging data to target intervention, really the industry can drive patient engagement, improve outcomes, and lower the cost. The cost has been also one of the keywords that you provided. And also collaboration is really essential. We are not talking of only collaboration into the health environment, the ecosystem. We need non-traditional collaboration, and this is important. It means it involves tech companies, it involves employers, it involves consumer companies, it involves, of course, governments. And finally, a long-term data-driven culture. It's important, and it needs to be more like data fluent, like the code you have on the right, and generating insight. When those data need to generate insight, it's not only about gathering the data, but really how we can use those data to generate insight in order to really take the right direction for my business. Finally, the third challenge is related to clinical trial transformation. And we saw that during the COVID, we had just to be innovative and try to accelerate the clinical trial process. And as indicated on the first box here, digitally driven trial is not only a COVID trend. That's true. It was a trend at the beginning, but COVID has accelerated this trend. And 93% of pharma life sciences executives answered that digital elements are important to their pipeline in the next 5 years. And also 98 said digital investment in clinical trial will increase. And actually it has increased. Those investments are just accelerating the adoption of digitally enabled tools. And that's a great news for Femtech, right? And we are going to benefit that if we are able really to look at what are the opportunities that are really across all the disease areas. And finally, behavioral changes. Truly, it's an important topic for Femtech. There is a lot of behavioral changes before even having a digital-driven approach. And what is good with COVID is we have this opportunity that this is happening. 66% of consumers will be willing to engage in remotely conducted clinical trial, which means that we were able to have these changes happening, and it's a significant challenge to address, and it's taken so much time to tackle behavioral changes, and that's a very good example. So in terms of implication, we need to really determine the right studies for these new models. Not all therapeutic area will be a good match. Mental health could be a good match, but it's not going to work for other therapeutics area. And this decentralized model using remote patient interaction should be really assessed case by case. Also, it's important to weigh the cost and saving on running digital trials, which will vary depending on the disease area, the location, the ability to store drugs, and other factors. And finally, addressing consumer concern is really critical, and it is increasing trial participant diversity. And this is an important point for Femtech because, as mentioned earlier, there is not a good representation of women in clinical trial. And if really you want to increase that, you want to understand what are the concerns of those participants and be able really to boost the enrollment for some underserved patient population like women. So before we close out, we want to ask you again a question, if you don't mind. And based on your perspective, how impactful are these 4 issues for your business? We did not cover the last one, but you can always include it, of course.
So here we are. You should be able to rate them now from 1 to 5. 1 is least important, least impactful. 5 is extremely impactful, relevant. And even if you don't have a business, I guess just generally what impact it has for your organization as a whole. The results are hidden for now, so I'll give you a minute to make up your mind, and I'll do the grand reveal. And
And you can use the chat, of course, and ask any questions. Start to ask any question if you have technical issues with the Mentimeter.
Looks like people are contributing, which is good,
okay.
Right? We already have 16, 18 now, so 21. So it's happening. So maybe give everybody another 30 seconds or so just to finalize, and then we'll go ahead with what we have. All right, I think we've plateaued a little bit, so we can have a look at the reveal. So it looks like harnessing data analytics comes in at the top, right? That's the most important one at 4.4, followed by evolving clinical trials at 3.8, and followed by striking the right balance on virtual care. And then it looks like supply chain resilience is the least important one. I guess we didn't cover that either, so we had a good feel there. Good. At this point, I think, as far as I understand, I would hand over to Cynthia, who would take over the moderation of the Q&A.
Thank you. Thank you very much, Ismail. Thank you, Sylvain, for that presentation and participation. And I wanted to open up the floor. We have a few minutes for questions, so please write them in the chat in the moment, so we can participate. Don't be shy. For those of you business owners and for those of you also researchers, these are interesting trends that we've seen, obviously, impacting overall health. So I'll give it a few minutes to for people to write questions in the chat if they have any. All right, so we have one. Do you see greater use of AI for femtech startups? Or I guess since the presentation is overall and in general for healthcare, do you see the use of AI? What is the role that AI plays?
Yeah, that's a very good question. Actually, we just finalized a project on femtech, and I would say 50% of those companies, maybe less, they somehow use AI-based solution, probably not their own solution, but they included in their collaboration, strategic partnership, and this is a trend in femtech. It's not only in healthcare, but it's really definitively in femtech, a real trend there. And we can see it also in terms of investment. Probably that's not the most relevant one in femtech, but it's still because telehealth. We saw that the technology was there, but no one was using it before COVID, and now there is a huge investment. Like it's over 100% compared to last year, and this is something that is going to benefit for femtech because we really need a way to analyze the data and gather insight, and that's true for any field in the industry.
Great, thank you. Any other questions in the chat? There's a question that says, are women more prone to use and adopt new tech in healthcare?
I love this question. Actually, one of the driver of femtech is the explosion of use of wearables by women, and wearables and all those digital solutions are not coming from healthcare, they are coming from consumer. And who is driving the consumer sector? They are not guys, they're not men, it's all women. We need like a preventative approach. We need to focus on well-being. We are not going to wait to be sick to take care of our health, which means that absolutely we are a very good adopter of this technology, digital solution.
We also have a huge purchasing power as well. So that is something that I think people are waking up to. Great.
Yeah.
Well, thank you both so much. I don't see any more questions in the chat, but I do encourage you to read down the report. We probably would post a link to connect with you guys as well. These are definitely really interesting trends that are here to stay, and they will continue to grow. So I think it's a good resource point for everybody here in the audience as we're all tracking the growth of these trends from different angles. So thank you very much, Isma. Thank you very much, Sylvain, for your time.
Thank you, Cynthia.
Thank you.
all.
Bye-bye.
Bye-bye. All right. So we're moving on to the next stage. As we saw, these digital trends that are affecting healthcare in general, and obviously impact femtech, as Isma mentioned. In fact, I wanted to share with you that 50% of our cohort startups have a digital health solution, or in this space of digital health. So you'll hear from them later on in the program. But as we also learned from the pandemic, not only pushing the digitization of healthcare, it's also had to push collaboration, and to bring about the solutions to get us out of this whole pandemic. So we've also learned that transformation of women's health and wellness is a collaborative effort. We're here to look at all the angles, from pharma, from research, as we heard earlier, from investment, from the innovators, and from startups. So we're excited to share that the collaborative aspect of this platform is open to you and to the public, and actually you can be a part of. So in addition to the acceleration of programs, the acceleration program for startups, Tech4Eva is on a mission to create a community of innovation around FemTech, which you can contribute to. And we have created focus groups, as Lan mentioned earlier, in which health innovators can develop solutions. We can identify pain points, raise awareness on the biggest issues around women's health and wellness. So I'd like to introduce our next speakers, who are the leader of our 4 focus groups, and they will detail share in more detail what the focus group section focus areas are. So I'll kind of introduce all of them, and then I will give the floor. So first we have Marta Gehring. She's the leader of Menopause, Pelvic Floor, and Period Health Focus Group. She's a business development and marketing strategist with a track record in biotech and medical devices. She's also the liaison for the Swiss Biotech Association for Western Switzerland. Next, we have Marco Reddy, who is the leader of the Prevention and Wellness Group. Marco is an entrepreneur, coach, and trainer in the Swiss startup ecosystems with over 20 years of experience in strategic and operational roles across life science industry in healthcare management. Then we have Haider Alec, who leads the Fertility Focus Group. He's the global head of digital excellence for Ferring Pharmaceuticals. He is also an entrepreneur, blending innovation, commercial, and marketing leadership into brands, and specialized in business transformation and product launches within regulated industries such as pharma. And last but not least, we have Douglas Hagstrom, who leads the Pregnancy Group. Doug helped to co-found the Day One initiative for healthcare innovation in Basel that brings together healthcare innovators from healthcare providers, pharma, and academia, and startups, as well as running its accelerator program. Without further ado, I'd like to give the floor to our 4 focus group leaders.
Do you want me to start?
All right, Marta, please, yes, go ahead and start.
Am I sharing?
Yes, you are.
Okay. So the Menopause, Incontinence, and Period Health Focus Group is really out there to set up a learning community for the participating people to better understand our target customers, to help refine the product market fix, and ultimately to drive investor interest so that we can move our innovation forward. There's 3 main ways that we encourage this learning. Therapy area discussions. We had very interesting discussions just yesterday on how we can develop the menopause and incontinence and period health market. Of course, to talk about the pain points on how we can collaborate better. What are the tech challenges that potentially remain that are relevant in terms of potential synergies among the different groups, and to share expert talks. Now, the menopause market is a $600 billion spending opportunity. It is said there's 1 billion women are going to enter menopause. It's 8% of the world population. We know there's a massive untapped market because due to stigma, silence, we are not seeking treatment. Yet there's opportunities in Generation X is now in the late 40s. These women are moving towards menopause. They're going to be in menopause for 30 years of their life. So it's a constant market, and they're digitally savvy and open to digital health. And finally, more startups are starting to pay attention to menopause, according to Crunchbase. On the other hand, women's overall health up to date has been really a fertility and contraception market. Even femtech has focused in other areas, which is great, but it hasn't paid attention as much to menopause and incontinence. And menopause today is really a $10 billion market in hot flashes, dominated by just 10 companies. So if you think of the fact that it's a $10 billion market with a $600 billion potential, you know how much there is to do. So a very exciting area. Urinary incontinence growing to a $4 billion market, growth driven by high prevalence of diabetes, pregnancy, and childbirth, which can cause urinary incontinence, and some positive trends in terms of minimally invasive techniques and new technologies. Yet there's 200 million that are suffering just from SUI, and it's still underdiagnosed. So our focus group has 3 meetups planned. We had one yesterday, one on September 30th and November 30th, if you want to join us. And we also plan some talks that we want to collaborate with Groupe Mutuelle for, therapy area discovery workshops for Groupe Mutuelle's corporate clients, talking, of course, about menopause, incontinence, and period health. But this is also an opportunity for the startups to pitch to these corporates and engage in an open conversation and get their feedback. So we'll be discussing that as September 30th to finalize those presentations. Now, the expert talks that we're going to do is not for the sake of expert talks, but it's for the sake of engaging in a conversation with the people in the group to say, how could we, improve our projects? What can we learn? What critical thinking can we engage in? So there's a talk about market research in the healthcare industry. There's a talk about how we tell stories to engage our consumers and to get them to click and make purchasing decisions. There's a talk to hear from P&G about how a corporate behaves when they acquire a new technology. They purchase the Merck OTC product line. There's a talk about building digital communities in order to, engage with their customers. Market access for medtech is an issue, and Brigitte knows Germany, France, and UK very well, so she'll help us to give an idea of that. And following yesterday's feedback that people have a challenge with deciding on pricing, I've invited a pricing expert who can help us think about how we price our products. In the focus group team, you'll also be able to access Oriana, who's here, as well as further members from the Groupe Mutuelle team, which we're very grateful for. So do join us to talk about therapy area innovation, leadership, and teamwork. Thank you.
Thank you, Marta. An excellent and super interesting topic. So we invite you all to check that focus group out. And next, we have Marco with the Prevention and Wellness Group. We can't hear you. You might be on mute still, Marco. We still can't hear you. But we can see your screens. Nope, no sound.
Is it now better?
There we go.
Sorry for that. So I have the pleasure to present on behalf of Xenia Tugay and June Lee Engler, who are members of the Wellness and Prevention Organization team and members of the Groupe Mutuelle, which are helping me to define the scope of what we are doing over the topic wellness and prevention. So the first good news is we had a very, very interactive first grade pre-session, which we are calling, with over 36 participants, which gave us a good feeling on what they would expect also on wellness and prevention. Somewhere interesting. You see on the top, there is one word coming out there. Everybody's looking for collaboration. On the other side, there is also the questions, how do we organize ourselves over time? And a lot of topics which are interested in the groups with votings, where we know how to drive also the content of the focus group down the road. So if we just pick up some of the elements, wellness and prevention, it's in a way so close, but it's still so different. If you just take into consideration prevention, everybody says yes, but somebody has to pay for it. Should it be the group mutuelle as a health insurance company who pays? What does it mean? How is the path to reimbursement? That scares away a lot of digital-driven startups because they just say, I want to make it quickly and we have to go to the market. So all these kind of questions have to be addressed. Shall I rather go to wellness, which is very often rather driven by out-of-pocket payments? So all these questions for startups are very central, and actually not only for startups, also for the corporates, because that's also a strategic questions which we will and try to address over the first weeks. What was a little bit the big surprise, this IP relevance in working between open innovation and classical business development was very, 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 very a lot questioned. How to deal with it when you go towards a collaborative environment, the co-creation environment between corporates and startups. And then logically also the questions, how can we scale and how can we organize the collaboration opportunities, go-to-market strategies, where is the customer grievance? And I think one thing which was very interesting as one central questions, the understanding of prevention and wellness in the countries, cultures, and different geographies might actually be very different. So these are a little bit the pockets which we try to address over the next 6 months. And how do we address them? If I can move to the next steps. So the goals, what we try to achieve is really working on this platform that we facilitate the interaction between the group members out of corporate startups and experts from the community as a learning group, learning together, but also identify pain points from the different type of sites and respect different pain points, because the pain points can actually be very different between corporates and startups from time to time, and identify common ones, which will help us afterwards to work together and investigate about solutions and potentially, hopefully also foster collaborations. If you look on the roadmap, we have this color code. Everything which is pinky is a pre-session, which we are usually trying to foster more insights on the topics which we then will challenge in the main sessions, in the green ones. And we go a little bit larger. We are inviting speakers, experts in different fields, so that the community, startup and corporates and the experts might have a benefit out of the main sessions. The first main session topic which is chosen that goes around open innovation, as before all of that is when we want to collaborate together, we have also to find out how can we actually collaborate together around in the field between the space of prevention and wellness. Having said that, the stakeholders and the partners, we are very open to all three dimensions, the startups as well, majority coming out of the Tech4Eva cohort, but we have also already other startups that have joined. In the first pre-session on the corporate side, very open, and on the community side, very different type of experts. What we are still missing, which we would love to have, are also parties from the regulators, because very often some of the questions might also have to be addressed and discussed with them on their progress moving towards new solutions. When we look to the deliverables, what we have set first out as a target, which we would like to achieve, is really building up the network in the field of wellness and prevention. And we try to foster work clusters on specific topics, mainly on the go-to-market best practices, what should be avoided, to be strategically also agile of what is coming up and where are actually the risks to going left or right. And on the business model challenges, one big thing between prevention and wellness is very often for startups, but as well as I already said, for the corporates, who pays for what actually, but that has a huge impact also in the designing of the business model side. And if we are lucky, we will all together be able to contribute to a community-driven book chapter in the Tech4Eva book, which should help us at the end to give also a little bit of feedback what we have learned all together. Next up, how to join us. The next big event is under the topic Open Innovation, a new buzzword, or a chance to foster partnerships between David and Goliath. And this is also the link back to my first initial slide, which you remember, the sumo ringers with a lot of little kids around it. I'm so sorry that I couldn't find the woman sumo ringer. which, as I have realized, seems also to be a difference in genders and is not so dominant. So please take contact with us, with Xenia, if you would like to have any kind of more details. And details on the 26th of August meeting, which is the next one, should follow on the Tech4Eva homepage. Thanks a lot.
Thank you, Marco. Thank you for that presentation. And next we have Haider to tell us more about the fertility focus group.
Yeah, can I share my screen? Yes, perfect. Okay. So hopefully you can see my screen. So yeah, so welcome to that fertility focus group. So we wanted in here to start building a path toward a journey for a healthy family. And here, based on the experience we have at Ferring Pharmaceutical, obviously we see a lot of things being an industry player in this field. My presence here in this group means that we can't do it alone. It's literally a collaboration exercise if we want to tackle those challenges for those potential parents. The idea behind this is that there is a journey that is both, emotional, physiological, it's complex, and there are many steps that even if you are a fantastic startup, you might have one piece of the story. And the goal of that focus group is to try to demystify and to structure a canvas, a framework, so that all of us can start collaborating. And we feel that is the missing block is an open collaboration platform to tackle the fertility and parenting building journeys. So we're not going to discuss that now. Obviously, we'll have the various session plan to see how we can navigate and who, in terms of stakeholders, can support that journey. How can we do this, and why we will, do it for which deliverable? On the impact delivery side, we wanted to make sure we have certain goals in mind, because we know that this is the permanent ones that we want to validate with the first discovery sessions. Level of awareness. We know that a lot of people don't know that they might have infertility issues. They don't just have the right information. It's trusted information, and there are disparity if you are in the north of our planet, the south of our planet, if you are in certain area, urban versus rural. So we will have to identify what are those issues. There is also a physiological path. So there is a system in place. Those systems are different across the world. They are regulated differently. They are potentially access issues differently depending on who you are, and that time to specialist is critical when you want to build a family, especially if you have fertility issues. And all in all, the experience is what we'd like to bring, not only a parent experience, a potential parent experience, a patient experience, but also the ecosystem around it. Those experiences, even as a doctor, are painful sometimes. So the way we'd like to structure those conversations together is to have a series of workshops to just define the scope and together find what we can chew in the amount of time we have. Then we'd like to build this framework together. We'd like to come as a team to say, this is the way we can all together look at the world and try to interconnect solutions together as an ecosystem. My inspiration is always, I don't know why, the fintech industry. If you look at 20 years ago, it was impossible to send money from one phone to another. Today, it's impossible to send a health record from one doctor to the other on Earth. So if we as an industry can start structuring that open collaboration framework, we'll be happy. And then identifying what are the call for actions, or identifying potential projects that could be middleware, data lakes, open data platforms where we can all contribute from the industry, but also from societies, from payers, and from the tech world to innovate together for having at the end of the day healthy babies. So wherever you are, whoever you are, if you have already experienced that journey, come to us. If you are in a patient association, if you're a doctor, a gynecologist, a fertility specialist, a startup, UX designer, wherever you are and whoever you are, we need you to basically start developing that framework together. So come and join us. We'll be animating this with Martia as well on the different focus groups, and we'd like to start that journey with you on the 15th of July. Thank you.
Thank you very much, Heider. Thank you for that. Another great topic area to check out. And last but not least is Doug Hackstrom. We'll talk more about the pregnancy group.
So hi, so I'm not Doug, but I will be presenting instead of him.
Great, thank you for being here.
Okay. Can you see my slides?
Yes.
Okay. So it's a pleasure to be here to present the pregnancy and postpartum focus group. As I said, I'm working with Doug on this focus group. And really, this focus group is aimed at tackling the issues, the challenges, but also the opportunities, the growing opportunities in this fantastic field that is pregnancy and postpartum. So we want to know who are the key players, what's next, what are the biggest opportunities that are next. We, of course, want to learn about the startups that are involved in Tech4Eva and how can we help them to connect with investors and other startups too. So as Mario had showed, we also had a great first meeting. We had it on the 14th of June. And we had 25 participants. We had 3 groups that were very active. And the aim of this first meeting or pre-session was really to gather what the participants in our focus group wanted to get of this focus group experience. So we were able to extract 4 main topics. So the first one was to really understand better the pregnancy patient journey, the value chain, the personal experience, and the startup experience. Another one, which I think it's common in all the focus groups that were mentioned so far, is to learn from each other, to exchange, to really build up a community around this topic. The third main topic was to understand corporate opportunity for the field of pregnancy and postpartum. And we really are keen to have corporate people joining us in the next focus groups to really have their pain point, their view on what the startups can do to evolve in this area. And finally, as it was mainly startups attending to this first session, we also had a lot of interest in enhancing the pitching skills from our startups. So naturally, the next meetings, thematics that were decided, the next one will be on mapping the pregnancy patient journey, the value chain, personal experience, and startups. A second one will be focusing on networking and exchanging. So we have startups from all over the world, from Brazil, from US, and of course from Europe. And I think it's very interesting for the startups themselves to exchange their experience and strategy and names of people who are key players in the industry. Finally, we wanted to have the hopefully soon a focus group specific with corporates that will come to explain their point of view, their pain points, and what they would like to have seen in this domain. And a more classical meeting which will be around pitching and funding opportunities in Switzerland, of course, but also all over the world. So our deliverables are very similar to the ones of the other focus groups. One of them being to have a chapter in the Tech4Eva group. The main objective, I think, for this first year and this first launch of the Tech4Eva, I think it's really to to really build and establish a network in this field, and to have really sharing experiences, opportunities, names, etc. And another keyword that came up a lot during our first meeting is really to collaborate. So people are really keen to collaborate and exchange. And of course, if down the road there is some funding opportunities, it will be great for the startups involved. So if you are a business investor, do not hesitate to join us too. So the next event will be on the 30th of August, and we'll be focusing on mapping the pregnancy patient journey. And if you had any question or any idea, suggestion, something that you want to share, you can contact Doug directly via his LinkedIn or myself via LinkedIn. So we are really hoping to see a lot of you, even from other focus groups, if you are interested, since there are some topics that are overlapping, like fertility and pregnancy. It will be very nice to have you. Thank you.
Thank you. Thank you very much, Lara. Well, as you can see, there's a lot of entry points for everybody to participate, with the goals for us as a platform to create a platform for everybody to come together to collaborate, but to strengthen this community here in Switzerland and also global community, as this is all virtual. So you all have opportunities to collaborate and to pitch into the growth of this sector. Moving on, this is the time we've been waiting for to meet the participating innovators and growth stage startups who are part of this program. Although you will only hear the pitches from the 15 selected growth stage companies, we want to share with you the additional 15 early stage projects, which you can also find on our website, tech4eva.ch, and they're here on your screen, some of the names. I also want to thank you for adding so many links on the chat. You're all already collaborating, sharing knowledge, sharing articles and books and research, etc. So please keep it going, and thank you for being so interactive. Also, if you are an investor, you'll have the opportunity to book one-to-one meetings with CEOs of interest post event. So we'll send that link out to you in the chat as well. So keep an eye out for these pitches and take some notes. All right, so moving on to the schedule, we're going to start with Aneda as our first pitch. So we're giving them time to get ready. And the presenter will be Gora Coleman.
Here I am. Can you hear me fine?
Yes, we can.
Okay. So, well, hello, everyone. It's been a very nice program already, and I'm very happy to start the pitching session that everyone has been waiting for. I'm Gora Conley, and I'm the co-founder of Anaida Technologies. So to make it simple, our mission is to help people in making babies. But you might ask, why would they need our help? I mean, it's pretty straightforward. Next slide. Turns out that the old-fashioned way doesn't always work out, even for couples my age. And this is a growing problem. Already 1 in 10 couples have to turn to alternatives, like in vitro fertilization. And then it's not so much fun anymore. But still, even though they're spending a lot of money, the chances of success remain frustratingly low, which means couples have to do it multiple times, more stress, more pain, and more costs. You want it to work the first time around. And a crucial aspect in getting that success the first time lies in the doctor's ability to choose the right embryo for transfer, the one with the highest likelihood of becoming a healthy baby. Unfortunately, the technology available nowadays doesn't help him enough in making that choice reliably. And that's where we come in. Next slide. We're developing a device that will enable doctors to choose the right embryo as soon as possible. What the device can do is it can detect the metabolic fingerprint of individual embryos without even touching them. It comes as a consumable like this one that we will sell directly to the fertility clinics. All the doctor has to do is place multiple embryos from the same patient inside this device, connect it to a machine for analysis, and get back a simple result, which is the embryos scored for viability. Next slide. Now, past, present, and future. So far, we've been very busy developing our device, supported by several grants, prizes, and a small pre-seed we did in 2019 when we incorporated the company as an SA. In April last year, right in the middle of the lockdown, we closed our seed financing rounds of 1 million francs with several Swiss investors, including some in the audience today. More recently, we were awarded an EU grant for nearly double of our seed round. This is money that will finance the ongoing safety and preclinical validation of our technology. But for startups, it's never enough. And already after the summer, we'll start fundraising again for our Series A as we move closer to clinical trials. If you want to know more and might be interested in joining us for the next round, please get in touch with me. So remember, Anaida Technologies. Thank you very much.
Thank you very much, Gora. Next up, we have Preg Life. Jada.
Oh, hello. Can you hear and see me?
Yes.
Nice. My name is Jade. I'm head of content and premium business here at Preg Life. We are located in Stockholm, in Sweden. And Preg Life, as you can see, is the #1 baby and pregnancy app in Northern Europe. Next slide, please. Our purpose is to empower families to give children a brighter future. We know that the connection between parent and kid in the beginning is very important to how the kid grow. So we want to give the tools for families to be able to get this connection early on. Next slide. Right now we are in 10 markets. We launched France last year on Q2, and we already got very great numbers there very quickly. We are launching Italy very, very soon, and we're going to keep expanding, but our biggest markets are Poland, Sweden, and Germany. Next slide, please. So right now, content is the core of our app. We have a huge team of midwives and experts that creates all of this content and make sure that all of the content is localized for each of these markets, making sure that all of the rules and recommendations are met. So with that, this content is like articles, guides, videos, podcasts, all of the knowledge that the parents-to-be will need to form this connection and to give the better choices to the children's future, to the child's future. So we have a pregnancy calendar that follows like pregnancy week by week. We have checklists to prepare your babies for arrival, weight curve from the moment the baby, diary. We have like also a way that you can follow the baby's development after it's born. So have a bunch of features like helping, supporting this period. Next slide, please. And today we kind of are in this like one fits all format, which we know that needs to be improved. So we are working already with app personalization, of course, following the privacy rules. We want to give recommendations, connect the users with health providers, prevention of risk, health improvements, and with that, like provide, like give back the data to the users so they can use their own personal data in the best way they possibly can. And of course, we have many other projects ongoing to improve our user experience in the app, which is premium content, expansion of free content, and improvements with UX and UI. Next slide. And currently, we have thousands of great reviews on the App Store and Google Play. If you don't know, the maximum is 5. So it's very, very good results we have there. And we know that our users really enjoy what we're doing. So that's why we believe that we have a very great future, a bright future by doing all of these efforts that I just told you guys about. So please contact us if you feel that something that I said is very interesting. Thank you very much.
Thank you so much for that. Up next is Gal's Bio from Hila Shavi. Hello, Hila. Are you there? We can't hear you or see you.
Hello, can you hear me?
There you are. Yep.
Okay, so I had some changes to my slide. Can I use my own or can I share my screen?
Oh, sorry. We're running out of time. So
okay, so I'll go with this.
Sorry.
Okay, so hi everyone. My name is Hila Shaviv. I'm the founder, the inventor, and CEO of Gal's Bio. And I will present to you Tulipon, which is basically a vaginal platform for women, for women's health and wellness. We are erecting a new branch in women's health, and I will demonstrate how are we doing that. Next slide. So Tulipon is one device with 2 goals. One is it will function as a hygiene device, and it will replace everything existing in the market today. And then in the future, we're going to use everything that is collected within that hygiene device, vaginal platform, to monitor and screen women's health. And we're going to do that with the assistance of a smartphone from home, with the accuracy of a lab. So basically what we are doing, we are taking the monthly secretions and we are treating them as a biopsy, monthly biopsy. Next slide. So you can watch the slide or you can watch me. This is Tulipon. This is the applicator. This already exists and it's being now used. I'm in Israel and it's being tested. And we are getting excellent results, as you will see. What is its advantages? So it is basically used like a regular tampon. It's disposable, but it is made from biodegradable material. We are solving the big ecological problems with all hygiene products. And it also not absorbing the menses, it actually collects it. And we have two sizes, and both of them are more than twice as much than a regular tampon can absorb. It's good for 12 hours with no leaks, and it's also going to be made with antibacterial coating, where we are solving one of the biggest problems with tampons, which is toxic shock syndrome. Next slide. So as I mentioned, this device, as you could see, this device already exists. And for the last COVID year, we've been testing it right here in Israel. And here you can see some of the results from our study. Women are really happy with the idea, with the concept, and also with the functionality of this device. Next slide. So what is our current status? So we have a reliable, easy to use IP protected working prototype. Post-market result, we have ISO, the medical ISO. We have FDA certification missing here in progress. And also we're starting now to get orders from a research institute that are researching the menstrual effluent. Finally, this arena is starting to move forward, and people are realizing that our device is the best way to collect the vaginal effluent and to research it. Next. And as I mentioned earlier, this having it as a hygiene device is only the first step in our journey. Our goal in the future is to use the menstrual effluent as a base for biomarkers to various women medical state to monitor and screen their health. Partially, some would be in the lab and some would be in the at home using a smartphone. And next slide. Okay, so so these are, for example, two of the boxes. Next slide. This is my excellent team. I wouldn't be talking to you without this team. We are all fully committed to this project. And we are now raising $3 million that will enable us to get to the market within a year and a half. Next slide. And thank you.
Thank you. Thank you very much, Hila. Great presentation. Up next is Metabolic Diagnostics by Hilary Cronin.
Hello, everybody. I'm Hilary Cronin, Chief Innovation Officer with Metabolomic Diagnostics. In 2021, an unacceptable number of women and babies still die due to bad pregnancy outcomes. Metabolomic Diagnostics have invested 8 years and €8 million in developing our pregnancy risk screening product, Prepsia, to make pregnancy safer for all. Our first product is now ready for market and predicts a woman's risk of developing preeclampsia in pregnancy. Next slide. Preeclampsia is unpredictable, often presenting suddenly and can progress rapidly to serious complications, including the death of both the mother and the baby. It affects between 3 to 5% of pregnancies, and the only cure is to deliver the baby. This is often premature, which has obvious serious consequences Due to preterm delivery, the cost of preeclampsia are significant, both in the immediate aftermath and due to the lifelong complications. In 2012, costs associated with preeclampsia were greater than $2 billion in the USA. It's clearly recognized as an unmet clinical need, with the FDA specifically called out as an example for their expedited pathway approval. When we do know who is at risk, there are known interventions that can help improve the outcomes, but current clinical practice is simply not identifying those at risk adequately. Next slide. The challenge with preeclampsia is its complexity. Recognizing this complexity is at the core of our technology development. PrEPsia's USP is that it is the fact that not all women are the same and that not all preeclampsia is the same. PrEPsia is a high-throughput screening for a variety of biomarkers in early pregnancy blood samples. The reading of these biomarkers can tell the mother and her clinician if she is at higher risk of preeclampsia. Her care can then be tailored, including preventative drug treatment and closer monitoring, which has been shown to improve outcomes. Next slide. PrEPsia is the result of 8 years of dedicated company R&D. It is based on strong IP portfolio and delivered by an expert team. We have strong links and reputation with global KOLs in the preeclampsia field, which is critical to support its market adoption. Next slide. To deliver the PrEPsia prototype to first revenues, we're following the route of an LDT launch in the USA. To deliver the product to this launch point in Q4 2022, we're currently seeking investment of $3.7 million. The US is our first target market due to the fact that preeclampsia is on the increase there. The US is an appropriate regulatory route, and we already have commercial discussions ongoing with a number of US labs. We'll operate a license model with fees of €9 million based on 5% US market penetration in year 3. In summary, Metabolomic Diagnostics' experienced team are delivering a solution to a clear unmet clinical need that will improve pregnancy outcomes and reduce healthcare costs. PrEPsia for preeclampsia is just the first prototype of a suite of pregnancy risk products that are in our pipeline with supporting IP. Metabolomic Diagnostics will transform the prenatal screening market globally, and we'd like to ask for your support in doing so. Thank you.
Thank you very much for that. Up next is TestMate.
Hello there. Good afternoon, everyone. Perfect. So my name is Sivina. I'm the CEO and co-founder of TestMate Health. And today I want to talk about quite an unsexy topic, and that's sexually transmitted diseases, STDs. So I'm a medical doctor by training, and I've seen so many conditions that affect lots of patients. But why do I think STDs are important? Next slide, please. So rates of STDs are rising globally, and there is still no rapid and easy test that can be done quickly to diagnose these common STDs, such as chlamydia and gonorrhea. Actually, the best improvement that we have made to date to testing of these diseases still relies on labs and takes days for a result to come back. And the WHO has also recognized this as one of the major problems of society. For example, chlamydia and gonorrhea today are the leading infective causes of infertility, but the treatment is so simple with a simple dose of antibiotics. Next slide, please. So at TestMate Health, what we're developing is a pregnancy-style urine test that tells you in minutes if you have any one of the 4 common STDs, and you can perform it anywhere at any time, no matter who you are. So you're guided through the test with a smartphone app that then captures the result at the end and allows you to connect to a doctor for follow-up and guidance if you need it. So the accuracy of our technology has been proven to be comparable to lab results. The solution sounds so simple, so why doesn't this already exist? And this is because the technology to achieve this is complex and it crosses multiple scientific disciplines, and we combine 3 breakthrough innovations in order to achieve our product. Next slide, please. So the key differentiator to existing market players is that our test does not need a lab. So we're really trying to take that next innovation step to offer a home-based test with immediate results and simplifying really the entire testing experience. And if we compare this to others, such as Everlywell, Let's Get Checked, their version of self-testing still needs you to post samples to a lab for processing. Next slide, please. So my brilliant team encompasses skill sets across molecular biology, consumer health, and medtech. And together we're working to achieve one vision, and that's really to make testing easy and accessible for all. We're supported by government grants, and we recently closed our first seed funding round, which was VC backed. And I'd love to go into more detail about the technology. So for anyone who's interested, please feel free to connect with me on LinkedIn and we can set up a call. Thank you very much.
Thank you for that. Up next is Impli.
Hi, everyone, and thank you for having me here. Perfect. I'm Ana Luisa, and I'm the founder of Imply, and we work in the space of implantables. And what makes implantables great is that you can really closely monitor from the interstitial fluid. And where we want to act first is combating and understanding hormone profiles of women. Next slide, please. And looking at the IVF sector, where frequent monitoring of hormone levels is very common and very necessary in order to create precise treatments and then increase the precision and safety of IVF cycles. And with that, we want to save time for females, but also increase decision-making or positive decision-making for clinicians. Next slide, please. And we do this with our small implantable biosensors that we have. And we span this technology out of Imperial College and have an expert team around us, both of clinical expertise as well as technological expertise to deliver this. These devices are about 16 millimeters by 2 millimeters wide and play directly into a smartphone, where a woman undergoing IVF treatment can deliver many more data sets in order to deliver more diagnostics data to clinicians for machine learning algorithms and analytics. Next, please. These sensors measure estradiol, progesterone, luteinizing hormone, and that increases convenience, precision, and safety of women. We're currently looking for our first funding round that we are undergoing, which is a funding round, and are in the process of completing our manufacturing plan and executing the first manufacturing of this. Thank you very much.
Thank you very much for that. Up next is Viveka.
Good afternoon. If I can introduce myself, I'm Andrew Tasker. I'm the CEO and the founder of Viveka Biomed. And I'd like to introduce our new product, Contrel Active Guard, which is a bladder support for women to address stress urinary incontinence. I think it's already been talked about today what a major issue stress urinary incontinence is for women. What we have here is a very simple consumer medical device to reduce or stop bladder leaks. If we move on to the next slide. Contrel Active Guard is made out of a cushion soft biocompatible foam. It's very easy for a woman to use. It's inserted into the vagina in a similar way to a tampon, though it works very differently. And the core differential about Contrel is it's designed to actually stop leakage. The product, if you can probably just see it here, is made out of a very soft foam, so very comfortable whilst the product's in use. It's run under the tap before insertion, and the product absorbs water and increases by about a third in size. And the mode of action is that it works very simply to gently lift the bladder neck and the top of the urethra to give women back control. Totally non-invasive, drug-free, and we've got 7 clinical trials that support its efficacy. And you know, this is the key thing about this for the product is women can either use it just during exercise or up to 16 hours a day. And the whole design and concept of Contrel is that it works immediately, but allows women total control. They can urinate as normal with the product in position, but it really means that women can get back into exercise and with all the other health benefits of it. As a business, this is a Class 2A medical device. We have just recently got our CE mark, and we actually launched the UK market last Friday and have had tremendous response already. And we're delivering to 30 hospitals in the UK over the next week, and we're already looking to launch into Europe. We've got advance orders from Sweden, Denmark, and Switzerland, which will be delivering during July. The product is a consumer purchase available directly off our website, but I've just literally this last week secured a listing with Boots, so we'll be available via Boots. So being able to go to the consumer, we do believe there's opportunity for healthcare reimbursement as well, and we've made a UK drug tariff application again this last week. So the business is changing very rapidly. We've gone from being a development business for the last 2 years to commercializing and activity happening very, very rapidly. We've raised a small amount of money to get to launch stage from private investors, and we will be doing another fundraise of approximately €1 million over the next quarter, to actually help to expand production capacity, because that's going to be our key bottleneck, as we recognise with the tremendous demand we've had already and the revolution that we're bringing to women's lives, is that we are going to need to triple production capacity as we look to expand globally. Thank you very much.
Thank you for that. And I just want to say we have a few more pitches to go up next, and we also have a panel on investment, VC investment, trends in investment, how to invest, and opportunities for investment in femtech. So don't go away, we have a few more to go. Up next is PhysiMed with Katarina.
Hello, this is Katarina from PhysiMed. PhysiMed provides unique connected medical technologies that change the way women take care about their health on a daily basis. Our first product is Emmy, a connected biofeedback device for pelvic floor training at home. Next slide, please. With Emmy, we address women's urinary incontinence that has a strong impact on the quality of life of affected women. More than 1 out of 10 women worldwide suffer from urinary leaks, most of them being younger than the age of 55. Training the pelvic floor to prevent or treat urinary leaks is thus important for women all over their life. Next slide, please. In fact, incontinence correlates with pelvic floor muscle loosening. The pelvic floor maintains, like a hammock, the genital organs, and is important for proper bladder control. The tonicity of this muscle group decreases due to different reasons, such as pregnancy and childbirth, heavy impact sports, obesity, or hormonal changes during menopause. Consequently, it is important for women to train their pelvic floor all over their life to improve bladder control and to stop and prevent incontinence or organ descending. Next slide, please. The smart Kegel trainer Emmy provides a suitable solution to strengthen the pelvic floor at home. It consists of an intravaginal device connected to a smart mobile application that offers motivating training within more than 20 different fun, serious games. It is a long-lasting device that is rechargeable within its charging box. Next slide, please. Our innovation proposes easy, fun, and efficient training at home. Kegel exercises are all based on therapeutic training schemes, an innovative biofeedback technology that was developed and patented by PhysiMed. The personal follow-up allows long-term results. It is possible to train with customized training protocols from healthcare professionals. The device is classified as a medical device class 1 and meets highest medical quality standards. Next slide, please. PhysiMed was created by 4 co-founders and is now a team of 15 people. We sell Emmy at €199 in all countries within Europe, in different countries in Asia, and also in North America. We are currently in a phase of international expansion and developing further products. We are not actively raising funds right now, but we would be happy to connect with interested investors or corporate representatives. In this case, please reach out to me via my email indicated here or with our CEO, Emmeline Hahn, via LinkedIn. Looking forward to meet you.
Thank you very much for that. Up next is Womb.
Hi, Womb is data science for women's health. I'm Laurence Fontino, CEO and co-founder of Womb. Next, please. Our solution is an AI-powered daily women's health tracker. On one hand, we help women during the different stages of their life, from cycle tracking, fertility, pregnancy, parenting, and menopause. But we also work and partner with the health industry to provide insight and also a premium version of Womb. Next, please. Womb collects more than 100 parameters, cycles, lifestyle, and differently biometrics data. And with our algorithms, we deliver
predictions on the fertile windows and the next cycles and the pregnancies. We also deliver tips, personalized tips, and then a powerful community. This is based on neural networks. Next, please. Our machine learning is unique. On one hand, we use ML to design predictive models. We have specific algorithms for irregular cycles. We also, on scientific and on R&D track, we use biomarkers. We have right now an image recognition on cervical fluid under a clinical validation. And then lastly, we have a premium SaaS for the health industry, for insurers, and then femcare and consumer health. Next, please. Great tractions with more than 200,000 monthly active users. We are present in 9 countries in 2 languages. And then in terms of monetization, we are 32,000 MRR in Q1. Next, please. Our core business model is a SaaS for brands targeting female audiences. For example, we launched with Mafre, a global insurer in 2 countries in Latin America, a special version of WOM for them. This is an interesting value proposition for the retailer, their current clients, and also as an acquisition tool as well, providing a product differentiator on women's health. Next, please. We're a team of 20 professionals based in Madrid. We're all coming from the tech industry, and we have partners with doctors and clinics on the medical and scientific side. Next, please. So we are raising today 2 million. We have very good investors already in our capital. We're looking for 2 million to scale our SaaS premium, and then we want to triple the MRRs to reach Series A for end of 2022. Please contact with us if you're interested to talk. Thank you.
Thank you for that. Up next is Move On Therapeutics.
Good afternoon, everyone. We at Move On are helping people regain control of life by means of regenerative medicine. Pleasure to meet you. My name is Diana Moore, and I'm the CEO and co-founder of Move On Therapeutics. We are a spin-off from the University of Zurich with the mission to advance a personalized cell therapy platform for skeletal muscle regeneration. Next, please. Please have a look at these statements. Significant number of women in your life feel like this every day. It might be your mother, your wife, your daughter, or your friend. Guess what they have? They have received the gold standard therapy for urinary incontinence, being slings. Next. And this is how one of our first patients feels, living a happy life. Stress urinary incontinence, next, is a disease that affects over 200 million people worldwide and represents the involuntary loss of urine by increased abdominal pressure. 75% of the affected people are women. Every 4th woman is affected after childbirth, and the dark numbers of the taboo disease are much higher. Importantly, it's not only elderly people's disease. SUI represents a huge economic burden to both healthcare and society, and the comorbidities are numerous, ranging from infectious through isolation, even up to severe depression. From the few patient statements before, you know how good the gold standard sling operation feels. Next. Having no optimal satisfactory solution on the market for moderate and severe cases, I decided to take the chance of translating what I learned behind the bench during my PhD time at DTH into a real life-changing solution for those people. All this by using patients' own muscle stem cells stimulated to do their job, namely personalized regeneration using no body foreign materials. Next. My vision is to make personalized medicine available to the millions of people needing it. Next. My team of experienced researchers and physicians managed a successful translation of the process from the bench to the clinic, supported by €6.5 million by the European Commission. Currently being at the end of our phase 1 clinical development, we secured seed funding of 6 million for our phase 2. And now are actively fundraising our Series A for the scaling up by incorporating high-end automation in the production process and developing our pipeline indications. bringing a brighter future to all silently suffering patients in need. Next. Thank you a lot.
Thank you very much. Up next is Mom Diagnostics.
Hello, everybody. I'm Matthias Wipp, CEO and co-founder of Mom Diagnostics. We care about the health of pregnant women, and our first test in development is a rapid diagnostic test for preeclampsia. Next slide, please. As you heard before from Metabolomics Diagnostics, preeclampsia is a dangerous and potentially deadly pregnancy condition. It is actually the second leading cause of death in pregnancy throughout the world. It affects a lot of women, so 2 to 8% of all pregnancies are affected. And if it turns out to be severe, an early delivery of the fetus may become necessary at very high costs due to premature birth. This causes around 500,000 infant and 75,000 maternal deaths every year. And on top of that, it causes a lot of long-lasting effects and a huge economic burden. So early and accurate identification of preeclampsia is crucial to minimize complications. Next slide, please. Our solution is to improve the diagnosis and thereby save costs for the healthcare system and save lives. We are developing a rapid blood test, which is used during routine pregnancy checkups at the doctor's office. So it tells the doctor whether a woman is at risk of preeclampsia or if preeclampsia can be ruled out for the next 2 weeks. So we focus on the second and third trimester, where around 20% of women will experience some sign and symptoms which are associated with preeclampsia. Our test helps the doctors to either immediately diagnose preeclampsia or rule out preeclampsia for the next 2 weeks. So the test is very easy to use. It's a drop of blood loaded onto a single-use cartridge, and in combination with our handheld reader, the doctors have the result ready within a few minutes. So meaning no complicated lab routines or time-consuming callbacks are necessary. This helps the doctors to delay interventions such as inducing labor and thereby improve the outcome for mothers and the babies. Our focus is clearly on outpatient management, so keeping the patients outside of the hospital and thereby reducing obstetric costs. I would like to talk more about technology, but please contact me if you're interested to learn more. We are currently fundraising, so I will put my email in the chat, and you also find our information on the Tech4Eva website. Thank you very much.
Thank you very much. Up next is Aspivix.
Hello, good afternoon. I'm Andrea Albornoz. I lead the marketing and sales organization. I'm here on behalf of the team. At Aspivix, we do have a vision, and the vision is to make gynecology now modern. And we live our vision by developing medical solutions that empower clinicians to deliver the best care to their patients. So we are a B2B company. Our first product is a solution to a real problem in gynecology. Next slide, please. And the problem is called the tenaculum. And the tenaculum is a device that affects more than 80 million women annually around the globe in common office-based procedures. And the tenaculum is this device that you can see here on the left. It was invented over a century ago and hasn't changed much since. And it's quite effective because at the end of the device, you can see these hooks, and it works by pinching the cervix in order to secure it, delivering, as you can imagine, significant pain and significant bleeding to the patient. If we can move on to the next image, please. But very soon, clinicians will have an alternative, Meet Cervix. This is our product, which is a next generation cervical device that uses suction technology to create that traction without compromising on performance. In fact, our early results of first in women trials conducted at the CHUV and finished last year showed very positive results, 80% reduction in pain and no bleeding. And if we could move on to the next image, you can see here a video of how the device actually works, very gently using a vacuum technology to secure the cervix, delivering no pain, no lesion, and no bleeding. Next slide, please. And we are, oh, this is not the last slide, but before we continue on, that's perfectly fine. We are fundraising, and I want to make that note. We are fundraising currently our Series A, 5 million Swiss francs. And the fundraising will fund 3 areas that are up and coming. One will be the launch of CareVix in early 2022 in Europe in 5 markets, and soon thereafter in the US. We also will fund clinical trials in the area of intrauterine device, but also expanding our clinical knowledge in in vitro fertilization, as well as help us develop our 2nd generation product. So please, if you're interested in knowing more, come talk to us, Andrea Albornoz at Aspivix. We will be happy to tell you more. Thank you very much.
Thank you very much for that. Up next is Brief ILO.
Hi, my name is Lisa. I'm CMO of Brief ILO. And 1 in 4 couples wait over 1 year to conceive. 70% of women don't track their menstrual flow, and 50% don't even know what ovulation is. That is the reason why we brought a team together. Next slide, please. And developed Brief ILO. Brief ILO is the first fertility tracker via breath analysis and works if a woman needs to breathe 60 seconds into the device per day, and then the data is transferred via Bluetooth to the Brief ILO app. She gets her fertility status and her cycle phase displayed in the app. Next slide, please. So we have a customer-centered business model. On the one side, you can buy Brief ILO once, or we have also the renting model, which has recurring revenues. The woman can do so via our own online shop or also via professionals in Austria. We work here with all pharmacies. Additionally, we're also working with insurance groups. For example, the Merck PKK covers already 85% of the product. Next slide, please. So we have some milestones achieved. We have several thousand users within the German-speaking area. Our customers are very satisfied, and we have a 5 times revenue growth over the last year. Next, please. But that is not all what you can do with the breath analyzer Brief ILO. We are also working on other applications. For example, in the COPD monitoring, we already have prototypes and we are doing first trials with users, as well as you want to go into the sports diagnostics for women in a later stage. Next slide, please. For our visions, we have already funded about 8 million euros, and we are not actively fundraising at the moment, but we are interested in a Series A in the first half of 2022, where we want to aim for 5 to 6 million euros. So if you are interested, please reach out to me or the team. Next slide, please. And thank you so much for your attention.
Thank you for that. Amber Labs is next.
Good afternoon, everyone. My name is Elizabeth Gazda. I'm the CEO of Ember Labs. Greetings from Boston. I'm here to tell you about the therapeutic power of temperature. Our technology was developed at MIT, and we were founded in 2014, which really speaks to the complexity of this technology. It took quite a while to bring this to market. We're 22 people, and to date, we've sold over 77,000 units direct to consumer at a price point of $300. Despite selling only in the US from our own website, the product has made its way into 170 countries. Next, please. By 2025, there will be 1.1 billion women in menopause. They will suffer from hot flashes, insomnia, anxiety, and brain fog for an entire decade, and there's no real solution. Today, women are spending about $2,000 a year out of pocket for partial solutions. Next slide. What we've done is discovered a new pathway to the brain using temperature as a messenger to balance the autonomic nervous system. All 4 symptoms that you saw on the previous slide are a result of an overactive sympathetic nervous system or fight or flight response. We apply thermal energy to the inside of the wrist that triggers the brain to balance the autonomic nervous system and dampen down menopausal symptoms without any medicine or side effects. Next slide. We partnered with Johnson & Johnson to prove out the efficacy of the device. We looked at the ability to control hot flashes, reduce hot flash interference, and reduce the insomnia severity index. In all cases, we were able to move these clinical measures in ways that drugs to this point have only addressed. Next slide. Today, we're raising a $20 million B1 round to take this product globally. By the end of 2022, we'll have $20 million in trailing revenue with our second generation product that launched in April. We will have developed new global sales channels with major retailers. And most importantly, we will be able to predict a hot flash before it starts and kick the device into operation. We are also on our way to have a signed partnership with a major global CPG brand, and we will launch premium features for recurring revenue. More importantly, we will have the largest data set on menopausal women and the comorbidities and experience that they have as they go through menopause. By the time we wind up this year, we will have 4 additional peer-reviewed papers from clinical trials in other therapeutic areas, such as oncological hot flashes, dysautonomia, stress, and sleep. Thank you.
Thank you very much. Last but not least, we have Gin Tools. And this will be a video.
Each year, hundreds of millions of women are suffering from misdiagnosis of vaginitis. Vaginitis, the inflammation of the vagina, is one of the most common female clinical disorders, affecting 80% of women, and it is the reason for 1/3 of all gynecology clinic visits, tens of millions in the Western world alone. Almost half of the symptomatic women are misdiagnosed in first clinic visits and receives inappropriate treatment. This mistreatment is leading to continuous patient suffering, loss of confidence in their physicians, repeated clinical visits, health complications, and multi-billion redundant expenses to payers. For this reason, we founded GynTools, and we're solving this problem with Genie, the first point-of-care diagnostic system that accurately diagnoses all major vaginitis conditions within minutes from a single swab. We developed a scanner and a dedicated sampler that, together with machine learning cloud-based algorithm, gives an accurate diagnosis within minutes. We're ISO certified and hold CE mark. We're already working with a Swiss distributor and Israeli HMOs to start sales later this year and have a marketing plan for the next years. We achieved these goals in less than 3 years, thanks to our skilled, dedicated team. We're looking for an A-round investment and anticipate sales by the end of 2021 and balancing in 2 years. We welcome investors and strategic partners to join us in fulfilling our vision. My name is Imrod Lev, co-founder and CEO. Please feel free to contact me. Thank you for listening.
Thank you for that. Thank you for all the pitches and the presentations. As you can see, we have some amazing technologies addressing women's health. And to the investors in the audience, we invite you to fill out the contact form so you can schedule meetings, one-to-one meetings with them post-event. So continue on the topic of investment. We got to explore the investment landscape of this niche, of fast-growing sector in the healthcare industry. In the next panel, you get to hear directly from venture investors on what are the funding opportunities in this sector. So next, I'd like to introduce the moderator for next panel, Pascal Cohen, CEO of Eva Women, a digital women's health company based here in Zurich, with a commitment also to supporting health research and development. Pascal, welcome to the event, and thank you for being here.
Thanks so much, Cynthia. Just one short clarification. So I'm not the CEO of Eva anymore. That's Leah, my co-founder, who is doing a great job. She's doing that much better than I could possibly do it. I'm one of the co-founders and used to be CEO and still in the board and involved with various femtech projects now. So that was great presentations, and obviously one of the key things to make it happen, to make innovation happen, and to make these companies big is access to capital. If we look at an average IPO and Nasdaq, they typically do 5 to 7 rounds or so, probably raise $500 million US. something like that. So understanding fundraising is obviously crucial. And we have a great panel here of investors. I'm super excited about the 4 panelists. Actually, Trudy mentioned earlier this afternoon that 93% of investors are men. So I think we're doing much better here in this panel. We actually have time only half an hour, so we plan to have 1 hour, and I'd like to speed up a bit. We prepared some pollings at the beginning and also a few slides, but I think I'm going to jump over that and would like to directly ask the 4 panelists to quickly introduce themselves, and maybe we can start with Caroline.
Hello, hello. My name is Caroline Gessa, and I'm the General Manager of Business Angel Switzerland, but I decided today, inspired by this morning's panel, to tell you why I'm here, why I'm motivated by Femtech. I'm the eldest of 4, but I have 3 brothers. And then I studied at ETH, mechanical engineering, like my father. Only woman amongst 150 men. And during these 4 years, I didn't have my menses, so it must have done something to me. Then I made a big part of my career at IBM. When they hired me, they said they hired me because I was a woman and not just because they didn't care. And since 2007, I work with BAS. Since 2016, I'm the general manager. I've myself done 12 investments and noticed today that 2 of them are Femtech.
Thanks so much, Caroline. 150 men and 1 woman. That's something that has improved, but we're not there yet. Thanks for this very personal introduction. I'm moving on to Tara.
Hi, everyone. I'm Tara Lichtenstein. I'm a principal at Ventures, looking after early stage investments in the therapeutics and life science space. So I've been at Ventures for about 3 years. Before that, I was with our parent company, Merck, managing strategic projects at the headquarters in Darmstadt. And my background is in immuno-oncology. I have a PhD from UCL in London. So Ventures is the corporate strategic venture arm of Merck. We're a 400 million euro evergreen fund. We are strategic in the sense that we invest into early stage companies in fields of interest to Merck. So those are therapeutics, fertility, oncology, autoimmune diseases, and then on the life science side, looking at enabling technologies and tools, for example, bioprocessing, single cell sequencing, etc. And then we also have a team looking after the electronics side of Merck. So we typically syndicate, we can lead, we can follow, we can co-lead, very flexible there. So our interest in fertility is, of course, big due to Merck's large fertility franchise with their therapeutics such as Gonal-F. Previously, as Ventures, we've invested into Progeny, which you may know, and are currently invested in one women's health company called Forendo, working on intracrine drugs for endometriosis and PCOS. While typically for therapeutic investments, or better said, for healthcare investments, we look for therapeutics. For fertility, we also look more on the tech and the tools side, and are actually currently closing one investment in this space. So very happy to be here today.
Thanks so much, Tara, and amazing to have you in this panel. Moving on to Under.
Thank you very much. Pleasure to be here. I started my career in strategy consulting in financial services. However, quitted my job to build up a digital health company, and yeah, as you can see, I switched sides. I'm now working for Swiss Post Ventures. We look into any scalable, fast-growing businesses, obviously in currently related businesses, but also like potential businesses which are relevant for the future. So anything from logistics, supply chain, digital commerce, communication services, and with this also related services like digital health and e-government. So as said, we are establishing an extension into digital health, thus we are actively looking for cases. We prioritize cases which are relevant to a broad population based on the broad reach we have. And we invest from the balance sheet, usually $500,000 to 1.5 million. And thus look forward to hearing from interesting startups. Thank you very much.
It's nice to hear that you say you're looking for solutions for broad populations. We discussed earlier that it used to be that femtech was a niche topic, and I think it's I think common sense that this is totally not a niche topic. So nice to hear that from you. And with that, moving on to Clea.
Yes, hi everyone. My name is Clea Wenger, and I am an investment manager at Swisscom Ventures. I have been with the team for 3.5 years. So Swisscom Ventures is the venture capital arm of Swisscom. We have been investing since 2007, have done over 70 investments so far. The areas that are of interest to us is obviously like digital tech, more like enterprise IT, cybersecurity, fintech, etc., edtech. But we are more and more looking also at the digital health space. So really this intersection between digital and also health. And we see actually that this is really increasing and more deals, especially also in Switzerland on that topic. And so this is a very important scope or investment area for us. And I see femtech as part of this. And on top of that, we also do more deep tech technologies like robotics, drones, AR, VR stuff, etc. So we are quite broad investment focus. Yeah, but maybe one thing to add, we have also just added a new partner. Actually, she is really with a pharma background, and she came in very recently in June, actually, just to build up really that health and digital health segment at Swisscom Ventures even more. So we typically invest between 1 to 10 million. That is kind of our check size, and we can go up to 20 million in a single company. In Swiss companies, we also lead rounds. When we invest internationally, we only co-invest with other syndicates. Yeah, what else? And we have 3 digital health companies in our portfolio currently. Ava Woman is one of them, and this is the one in the femtech space. The others are Sophia Genetics and Skylight. And yeah, so that's...
Thanks very much, Clea. Let's kick this off with talking quickly about the femtech industry. I mean, it's clear that the space has developed enormously over the last 10 years, and we saw that big time at Eva. Also, the interest in femtech has grown tremendously. But we also heard at the beginning that femtech or women's health only attracts 4% of all healthcare investments, which obviously is a very low percentage. Caroline, maybe starting with you, how have you kind of experienced this industry over the last 10 years or so? And what do you think needs to be done that femtech keeps growing and gets to a status that is deserved?
For me, really, it's part of a huge movement that started with the Me Too. Personally, I was made very conscious of this so-called vertical 2 years ago when one of my nieces had planned to work for a VC in Japan that only did femtech. And then I realized, oh, and I looked at our statistics at BAS, and I made an extract of all the ones that had to do with femtech, and I realized that this is a growing thing. Now, and now I'm really focusing my eyes and realize that we are doing so, that our women members are investing in femtech. I mean, we have an overproportion of women in the investment teams when it's about femtech. So obviously we are touched by this. So increases the number of women business angel will also increase this. And my motivation in this is to realize how long this has been. I mean, there are so many taboos that are now tackled by these new startups. And therefore, there's a huge potential that the era where women have to suffer in silence is maybe over or coming to an end. And also what we have to do now is more of the event like today, because I already learned in these 2 hours a whole lot. So there is a lot of catch up to do, and a big future for Tech4Eva. So congratulations.
And I mean, we also talked about that stuff like preeclampsia or PCOS or stuff. I mean, this is just what a typical male investor probably hasn't experienced, maybe doesn't care as much. So maybe looking at you, Clea and Tara, I mean, how do these discussions go in your teams? If you have males and women around the table, do you feel that there are topics that are, just because they're closer to your own experience, that are then also more driven by women? Or is this kind of, are you just completely rational and you don't really care about that stuff?
Yeah, so from my experience, so we are mainly focused on fertility and improving, a big piece is improving IVF outcomes. And I feel that there also a lot of men have a stake in the game and have own experiences. So from my perspective, I haven't seen that there's more of an interest from our female team members than from our male team members. But I may be a bit biased there since we mainly focus on fertility.
I would maybe slightly contradict there, because I think this is a general, not specifically for like this femtech, but I think it's much easier to convince or excite an investor about a certain topic if he or she knows the problem from maybe previous experience or previous career. And so I think, and I think to really recognize the value of a certain startup or a product or a solution really comes from knowing the pain point. And so I do think it makes it a bit more difficult for this kind of femtech companies to convince a male investor. I do think there is kind of, if you talk to a person that has experienced the problem, that it can turn out in a more positive outcome for the startup.
Yeah. No, and I mean, it makes both sense, and it's true that fertility obviously is not a female topic, whereas others obviously are. I would like to switch and talk a bit about timing of doing an investment round. My own experience is it takes a very long time usually to raise money. If you take in preparation and until the money is on your account, it can take 6 to 12 months. And obviously you hear a lot of story if you read that, especially Silicon Valley with but also big investors like SoftBank and Tiger Global and stuff, that funding rounds are being done in 48 hours, stuff like that. So can you maybe tell me a bit from your perspective, like how is timing usually? And I don't want to kind of hear, probably all investors have these stories where you invest within a super short time, but what is the typical time frame and what would you recommend two startups in terms of how long this takes. Maybe Önder, we can start with you.
Okay, thank you very much. It's really there is no standard fits all. If you ask for an average, I would say 2 to 4 months, because you get to know the team, and then obviously we'll have a couple of interactions and also try and check different things. But of course, we have also cases where we did a due diligence and an investment within 2 to 3 weeks, but this is very uncommon. So thus, it's quite sportive.
Yeah. Caroline, how does that look on your end?
Yes, we should be quicker. I mean, theoretically, our people are investing their own money. They don't have a board to ask. So as soon as they're convinced, the term sheet is agreed, the investment can flow. Maybe we're a bit slower before because we have a jury that selects the startups, then we have a monthly meeting. But once the meeting is done and the team is there, then it's just a question of availability of our members to meet or e-meet and decide. So, but there is a certain number of weeks that goes. Once it's agreed, it can go very fast. But from what I've heard, I think 2 months is really a bit an incompressible amount of time.
Tara?
Yeah, I'd like to add that in my experience, it doesn't only depend on the investors' processes and timelines. I mean, the tip I would give any founder or somebody who's fundraising is to really actively guide VCs through the due diligence process, be prepared for each step, follow up regularly, etc. Because a lot of the timeline depends very much on the companies. So I just wanted to mention that.
That's an interesting one. I would like to follow up here. I mean, how pushy can you be as a startup? I mean, isn't it like that if you get after 2 days an email saying like, hey, well, what is your, aren't you kind of getting annoyed? Like how much can you push really?
Yeah, of course there's a balance. So of course being too pushy, emailing after 2 days is of course a little bit too active maybe. But I mean also in terms of so giving sufficient time to the investors to review. But if we sign a CDA so that then the data room is really ready, and then because otherwise if we then wait for like 3 weeks for the data room to be ready, then we're all human. So then sort of other things come up. So I think it's important to be prepared at each step.
Great. Clea, what are your thoughts around that? Or how does it look like at Swisscom usually?
I can just totally agree with Tara and Önder.
Perfect. And I mean, I think it's important for startups also to realize that this is basically the 2 to 4 months where I think we have a kind of agreement here in the round. I mean, this is just the time you reach out to investors, and obviously you need to prepare before that. You want to be investable. You probably want to do some pre-discussions with certain existing or new investors. So all that stuff needs to be added. Yes, Caroline.
Yeah, just one point. For us, when the startup comes and said it's really urgent, it's a no. So urgency, no. They need to plan in advance.
Yeah. I mean, ideally you still have, at least 6 months, probably better 9 or 12 months of cash on your account. And often I've experienced it's best to raise money actually when you don't need it as a startup, as a free tip kind of. I would like to talk about introductions because obviously it's important, right? If you know investors, the chance that they're going to look at your deck is much higher than if you don't. That's obvious. But now let's quickly make the round. Like, how important are they really? Like, would you not even look at the deck if it just is just a cold email? Or would you still look at it, but you say like, but it's just much better if you have an intro? Like, what are your thoughts around that, and what would you recommend to startups in that respect? Maybe Clea, starting with you.
Yes, sure. So actually, we definitely look also if you don't have a, let's say, personal introduction. So actually, even on our website, we have a link with a simple template with a few key metrics that a startup can fill out. And then it actually automatically lands in my mailbox. So we definitely look at all this inbound and also give an answer to those. But yeah, of course, it's if it gets, if you get a warm intro from someone and you trust, and it's it's obviously even better. So I mean, maybe what startups could do is try to check on LinkedIn whether people in your network know someone that and then maybe ask through those people.
Yeah. So it's not a must-have, but it's better to have it, and LinkedIn intros or so would, yeah. Tara, any additional thoughts on your end?
No, yeah, it's similar from my perspective. Of course, introductions can help because inherently we take on a lot of risk. So getting comfort that maybe a KOL in the space or another investor, an industry expert appreciates the science or the team is of course already one good sign. But we ought to look at everything. The tip that I would give is to, of course, also choose wisely who you use for intros, because it could also be counterproductive. What could be useful is finding a mentor who successfully raised funding before, who can give tips, but also support with the network, and then get industry experts and KOLs as advisors, either formal advisors as an advisory board, or more informally, who can support in opening doors and show the world that such experts believe in your technology and team.
Great input. I think super valuable input. Yeah. Anything to add on that side?
Just we are early stage investors, so obviously people might not have lots of references, but in Switzerland we trust the venture kicks and all the mass challenge and all this at the vendors. If a startup has gone through successfully several of these things, it's always positive. And of course, all of our members are a network, and if they recommend one startup, it is of course a very positive.
Yeah, makes a lot of sense. Now, I would like to ask all four of you a question and just kind of one word answer, and it's basically what percentage of startups that would send their pitch or an email to you, into how many percentage do you actually do an investment? So if you get 1,000 pitches a year, like what would be, into how many would you invest? Yeah, Tara, do you want to start?
Yeah, for about 1,000, we do 4 to 6 new investments per year, so less than 0.5.
Okay, Clea?
We look at about 1,500 decks and invest in maximum 10 per year. So yeah, less than 1%.
Caroline?
So we have 360 per year, and we invest in 12. But we have 60 pitches, so 12 investments out of 60 pitches that we look at, invite.
So that's a bit higher, a few percent, but also low single digit under?
Similar like Swisscom, we get 1,000 to 1,500 cases, which we review less than 1% because we invest in 2 to 4 per year.
And I think that's a very important point for all startups. I mean, if you think about it, I mean, out of the 1,000 or so that you get, I mean, there will, of course, be some that probably don't make much sense, where the team or the market or the product or traction is not there. But still, there will be hundreds or at least dozens that are actually good startups. So I think it's very important to actually understand that that a no is just part of the game, that you need to talk to probably many investors. Maybe you have your prio one list, but you probably need to talk to many. And I guess it's also a great thing if you have first term sheets and stuff, then it's easier to kind of send an email to Tara and tell her, hey, now we need to get your decision. So kind of playing this FOMO, this fear of missing out on the investor side. Let's quickly talk about mistakes of startups. If we have this great group here, kind of what are things that you see where you just say, like, you're making, just saying, like, if I would do my own startups, I would never do that. Who wants to start here? Under?
Perhaps as an ex-entrepreneur, so trying to solve too many problems at once, I would say focus on one thing, solve that very good, and then expand your product.
Great input. Who is next?
So we invest in people, and so you have to come across, but the big mistake would be to lie. I mean, if we suspect that something is not totally true, it's an immediate no-no. Don't make it look nicer than the real truth.
Great point. Tara?
Yeah, I agree with Caroline that overselling is not helping you. So make sure that everything you state you can back up with data. And the other thing is to really crystallize what is the unmet need that you're addressing. Is there really a problem and a need for your product? And why are you differentiated to other companies in this space? I think these are two of the key components that any proposal should have.
Maybe just one question about that. I often see that in Silicon Valley, people pitch much more aggressively and kind of, paint a very rosy picture, whereas I think definitely the Swiss, but maybe the Europeans in general are more conservative and stuff. Like, I agree about not lying, but how much kind of euphoric do you expect the team, or do you still kind of say, like, okay, this is good selling and not lying?
So I think it's a really a balance between, like, lying is, I think it's really not an option, but then low energy is also not an option. So I do think needs to be that balance between, like, being enthusiastic, believe in what you do, bring also that energy, because in the end you have to transmit your story and the whole product to the investor, and it's difficult to get excited as an investor if the entrepreneur himself or herself is quite low energy. And so I would say not lying, not overselling, but being kind of passionate and bring that through.
Cool, great point. We have 3 more minutes. And my last question is about valuation. Obviously a big topic as well. I mean, for startup founders, like, what is the right, how much should you push and try to get the highest valuation, understand dilution and that kind of stuff. So what are your thoughts around valuation? How do you even come up with a valuation, and how important is it? Caroline, maybe you have lots of experience with valuation in early stage.
Yeah, but we made our life very simple. We say we don't even look at a startup where the valuation is over 5 million. It's maybe a bit simplistic, but there has been such an inflation through our colleague coaches who start to boost the startups and have them think about sky high. Also for us, because we are in the most risky part of so if we invest at double the value, then we need double the number of successes just to get our money back. So we have made it very simple. and then it is a negotiation. Of course, two guys who have worked for 6 months and come with a valuation of 2 million, I ask them, do you really have a salary of 1 million a year or 2 million a year? You know, I mean, where does it come from? But there are, of course, many theories how to calculate it. But at the end, I mean, at least to look at the project, we made our life very simple with these 5 million.
Yeah, great. Early stage seed, that makes sense. Clea, do you want to go next?
I actually made a 1-hour session on how VCs approach startup valuations at the startup days last week. So it's how can I answer this quickly? I mean, let's say at seed stage, we also kind of do like a rule of thumb. You know, basically, we have a pitch book. We use pitch book as a market intelligence database, and we can see that globally, the valuations at seed stage are between 3 to 6 million, somewhere in that range. And basically then the value drivers are the market opportunity, the team, and the product and the tech. So it's kind of a rule of thumb.
Great point. I know, Tara and Dunder, you have a hard stop at 4. I'm not sure whether you can kind of 10 seconds or so each add to that.
Yeah, no, I mean, of course, what drives investors is the exit potential. And that can be analyzed either through comparable companies exits or market potential and revenue multiples. So of course, this is something that investors look at and that founders should think about. Of course, also too high valuations could jeopardize the next financing or potential IPO. So these are also things to look at and understand that maybe not always driving for the highest possible valuation at this stage is beneficial. And then, of course, what I'm a big believer in is that it's more important to get really the right investors on board, the right syndicate that can support you and support you long term to build a valuable company than getting a less optimal syndicate with a higher valuation, because what counts in the end is what you're building towards.
Great points. Thanks so much. Under, last statement.
I can just agree with everything that the ladies have stated. So perhaps the one thing, the positive thing about seeing lots of cases is that sometime you get a feeling of what a book valuation is. If I just need to say one thing for a startup, have a look at a revenue multiple in your space, and thus this already gives you a good indication whether you're really quite high or low or somewhere in the mid-range. This is the only thing which I can add.
Hey, thank you so much. It was a lot of fun doing this round with you. Thanks for all the great insights. And we're 2 minutes late, but I guess that's still kind of okay. So thanks a lot. And I'm not sure whether there are some last words from EPFL or Groupe Mutuelle, or whether that's it now.
Thank you, Pascal. And thank you to all the panelists. I think this is a great discussion, and I hope it helped provide some insights to the investors in the room as to how to approach their next investment, particularly in femtech, as well as to the startups in the room, not only in our cohort, as to how to approach investors in the space. Once again, we want to continue, encourage you to stay in touch. We've really mentioned all entry points for the audience to get involved in this, the focus groups, but also connect with our social channels. Our YouTube channel, we will be updating with videos from our startups. Through our social channels, we'll also be sharing the progress of some of our companies and all the information you can find as well on the focus groups. So we want to just thank you for that, for your participation. We've arrived at the end of the program. So I'd like to pass the word to our program director, Lan, once again, to share with us some action items on how you can join the growing femtech community and stay connected. And Lan, over to you.
Thank you very much, Cynthia. So first of all, I would like to sincerely thank all our panelists and speakers. So thank you very much, Trudy, Sophie, Oriana, for the first panel, and also for Isma for giving the insight. And lately, thank you, Caroline, Clea, Tara, Ander, and Pascal for animating this very insightful talk about investment. So I believe that you have all done your wonderful contribution and to today's roadshow and bring your insight into the femtech topics, and that I'm sure that would further raise the interest and the motivation for all our audience to engage themselves into the cause of women's health. I would also like to thank all our startups for their commitment to our initiative and for their determination to reach out and improve their solutions. Last but not least, I would like to thank for our colleagues that animate for the focus group, and thank you for your commitment and for your hard work. Tech4Eva is not a one-time program. It is a long-term endeavor that we plan to run into the years to come. So already this year, a lot of activity has been planned, and I warmly invite you to join us to discuss the femtech ecosystem. So the upcoming events would be also the London Roadshow. It's scheduled in September 20 to 21, and that will consist of workshop of market entry strategy and also strategic partnership and to meet investors. Next slide. But this is not all. So during all the summer, starting from in 2 weeks, you're having focus group activity that's open to all the public. Here you have a recap of all the topics, such as July 15 for the focus group for fertilities, and August 26 for the wellness and prevention, etc. You are going to get all this information from our follow-up emails, and please check our website for the upcoming events. So maybe now I would like to invite my co-founder of Nicola, if you have some words to say for concluding this event. Nicola.
Yeah, thank you, Lan. I think it was a very high quality session today. We thank you, Pascal, and everyone on the panel. It was very insightful. I have some questions to you, but we will reach out separately, and we'll try to share everything. Yeah, I received many questions in the chat on the sharing of this session, and I think it will be made available to the attendees on the YouTube channel, so that you can review it and get the best of all the insights that we got today. Thank you very much. Thank you for the team as well, Tech4Eva team.
Yeah, thank you all, and keep with us. Stay with us for the next event. See you all, and have a very nice afternoon. Bye.
Bye.
Bye-bye.